Sure that we have enough folks joined online and in person so that we do have a quorum and can proceed as planned as well. All right, well, welcome everybody. This is, and good morning. Thank you all for joining in person and the folks online. I really want to begin to thank everybody for those who came here today. I know some folks even flew in for this meeting. Thank you very much. And all of you who joined online, I know we have quite a presence there as well. So thank you very much. I want to thank my executive leadership team who will be joining us sporadically at different times remotely today. And we also have some folks who came for this meeting as our partners. We have a lot of representation today in person and online. We also are joined today by Dr. Katie Ho. Thank you very much for joining us from Portland Community College. And we have partners from different workforce boards. So thank you so much for joining us today. I also want to thank, before we jump into my team who is behind the scenes, and Summer will be coming here a little shortly, who helped to make this meeting go really, really smoothly so that it is also worth your time today. Because it is a long meeting, it is till 1:30. We have a fully packed agenda, a lot to go over, and also very interesting presentations and working group discussions we will have, and some actions that we will be doing during the meeting and right after. So the Healthcare Consortium, Industry Consortium really exists because healthcare workforce challenges cannot be solved by anyone alone, any of the organizations alone. And our role in this consortium is really to bring together those closest to the issues and those best positioned to influence the solutions. So today's conversation is really timely. Our theme today, you can see it in your folders, it is protecting Oregon's healthcare workforce pipeline, student access, workforce impacts, and collaborative solutions. This meeting is not about us predicting the problems. We know that they exist. It is really the purpose of this meeting, and for all of you being today here in person and online, is to understand potential impacts early enough so that we can work with those who are closely impacted by them, and also identify those actions that we can take starting today and on to prevent huge disruptions at the workforce. So throughout this meeting, we will hear from a workforce industry specialist and a workforce board representative. We'll hear from OHA HR1 Focus Team, OHSU Assistant Vice Provost and Director of Financial Aid, a nursing student with a very compelling story, OHSU School of Public Health and Klamath Community College. We will also have a facilitated discussion where every one of you will have a chance to share your ideas. And also we will be advancing some working opportunities for the next quarter for us and ongoing. We'll also be joined later in the meeting by our director from Policy and Legislative Affairs Office, who will let us know what solutions already exist and what we can do in the consortium to advance some more work in this area. And finally, we will hear from our partners from OHA, who will be seeking your feedback on the Healthcare Workforce Needs Assessment Report. By the end, we'll wrap up with a few announcements, very interesting and critical working announcements, and we'll wrap up by 1:30 and be out of this door. So, let's proceed then. I hope everybody had a chance to review the meeting minutes from April 23rd. And I'd love to have a motion to approve. Is there a motion to approve, accept? Second. We have seconds. We have a motion. So there is a motion and a second. Thank you very much. Do we have any objections? All right. Hearing none, I think we can then proceed. Thank you very much. It's approved. Public comment. Rona, do we have a public comment in the moment?
Not at this time.
All right, perfect. Thank you. That was quick. We are going to start right now with a presentation from our partners from Jennifer and Sabrina, who will introduce themselves with a little bit more details, and will share some really interesting insights around the workforce boards and the sector partnerships. And mind you, this is just a very short presentation. This is not nearly enough of what sector partnerships looks like, what they achieve, what they do daily. There's so much. The reports are huge, so they try to concise it so that you get a glimpse. And if you want to connect with them afterwards, which I highly encourage you to do, please do reach out to them afterwards. And I know that they're joining us within a few minutes because we're 2 minutes actually ahead of time, which is perfect. So they will join us here in just a few minutes. For folks online, we're giving a few minutes here in the room to grab some final tea and coffee so that we're settled for the next presentation. So we will start in just a few minutes.
Yeah.
Good job. So maybe give introductions.
All right. Hey, everybody. Welcome back from after your break. Nothing like coming into a presentation exactly when you're supposed to start it. So sorry about that, everybody. I got a little confused, a little bit sick right now, so bear with me and keep your distance. All right. I feel bad for anyone who has to touch this microphone after me. So sorry, we'll sanitize. All right. So my name is Jennifer Rice. I'm a workforce industry specialist at the Higher Education Coordinating Commission. And what I do is industry outreach and industry engagement, and I do some grant administration. Before I jump into this presentation, I do want to say that we have a grant available that's open right now for short-term credential curriculum development. So for programs that are attempting to align with workforce Pell, this would give you some kind of money to realign your curriculum to be eligible for workforce Pell funding. So this would be for either new programs, expanding programs, or modifying programs to be eligible for workforce Pell. If you have questions about that, please find me later, but again, keep your distance. Yeah, or you can email me, and if you're on chat, you can't get sick from that. All right, so I'm going to give you a little bit of an update on what the local workforce boards are doing in the healthcare sector. So next slide, please. So today we're going to go over what the heck a sector partnership even is. We're going to go over the executive summary of what the local workforce boards are actually doing in healthcare around the state. We'll talk about a little bit of their challenges, what they're facing out there in the healthcare sector, and then what opportunities we feel that maybe there is out there, and things that they would like to focus on. We're also going to talk about some success stories and regional highlights. And I'm going to keep that so high level only because I want you to be curious. I want you to be like, man, that thing about Rogue Workforce Partnership, they're doing something cool, and I want to know more about that because I'd like to bring them into the space to then share more about what they're doing. And then a little bit of a teaser for right now is that I already did that for work systems in Portland. So they'll be coming in right after me to share a little bit more about what they're doing in healthcare. Then we'll go into some high-level recommendations of what they would like to see be focused on in the healthcare sector. Next slide, please. All right, so you may be asking yourself, what is a sector partnership? A sector partnership is an industry-driven alliance of regional employers, training providers, community-based organizations, and state agencies. The intention behind sector partnerships is that they are industry-driven and that all the folks who are in industry drive what outcomes occur as a result of those sector partnerships, and then training providers and other state agencies gather around industry and help support them to accomplish their goals. So that's what they're doing. It's kind of like a consortium on a smaller level, so more regional. All right, you could go to the next slide, please. All right, so this is probably pretty small for all y'all, but the main thing I would like to showcase here is that every single workforce board around the state has a sector partnership in healthcare. Every single one of them. That's really the whole point of this slide, to be honest. Next slide, please. All right, so what are they doing? The local workforce boards have strengthened partnerships around the state with healthcare businesses, actually talking to business about what they need and what they want and how to meet those needs. They're trying to figure out strategically on exactly what they're going to do. And you'll notice some regional differences. Like what's important in Portland is not the same as what's important in Southwestern Oregon. We all know that employers are going to face turnover and burnout. We know that. I think that you all know that too. Especially with their capacity in clinical placement. I think that that's a real challenge for people around the state trying to figure out how you can get supervision hours and in more rural areas where those resources aren't as readily available. Some opportunities that have been identified is youth pathways, trying to engage youth in a way either like CTE or pre-apprenticeship. There's a lot of opportunity to engage youth in this space. Also, work-based learning is kind of hot right now around the state, so I wanted to highlight that, which could be incumbent worker training, it could be onboarding training, but any work-based learning where you're getting paid to take training, I think that's some opportunity available. And improved collaboration, so they're getting more employers, more people are engaging, and I'll tell you exactly how many when we get there. So like how many businesses each local workforce board has added in the previous quarter and at the biennium. All right, next slide, please. All right, so common challenges, we all know this. We know the turnover rate, we know the burnout, we know the training capacity shortages that exist for employers. Like this is information I've heard you all talk about before. There are recruitment challenges, the employers face administrative burdens, and there's a lot of data gaps. I mean, it's hard to know what credentials an employer is actually looking for without getting that information from them. So, and then the last thing is policy shifts and uncertainty. I think people are a little bit nervous, I think, about federal trends and about changes happening just in general. So there is some of that and some gray area there that they feel. All right, continue, please. All right, opportunities that exist in the reporting is to expand career pathways. What are they? And I feel like I've heard you all talk about that as well. Like, what does that actually look like? They also want to know that, and there is an opportunity to work together on that. Increasing that clinical capacity is talking to employers about what that would look like for them and how to meet employers where they're at. I think it is also a real challenge. But within each challenge lies that opportunity. And then enhance those rural training models and those regional partners, like how to meet people where they're at in that way. All right. Next slide, please. I'm going a little bit fast, not because I'm late or anxious, but because I have a lot of information in a short period of time. So, and that being said, I would like it if you could please think about what local workforce board you have questions about, or what local workforce board you would like to invite into this space to share more about what they're doing as I'm going through these regional highlights. All right. So since the beginning of the biennium, Clackamas Workforce Partnership, hey there, I see you, has added 177 healthcare businesses since the biennium. That's a lot. We know Esmeralda's out there talking to employers, talking to them about their needs and how to meet them. So thanks for that. But they're strengthening long-term care partnerships. So long-term care is helping, I think in most cases, older adults and assisted living facilities. So that's kind of unique around the state, to be honest. They're also working on peer worker training and planning more youth internships. Next slide, please. I'm gonna blast through these next ones. That was a little slower, but we're going to go faster. All right, East Cascades Works. This is kind of like the Bend area broadly. And when I say broadly, I mean Hood River to Klamath Falls. Broadly, this is the middle of the state. All right, 34 healthcare businesses have been engaged since the beginning of the biennium. They've made progress on their own behavioral health consortium. Interesting, fascinating stuff. They've reestablished their healthcare sector partnership. They've revamped it and then decided they're going to do a model that meets employers more where they're at. So the associations that they're involved in, they're embedding themselves in that, as opposed to having their own sector partnership that's standing. They've strengthened CTE and employer partnerships. So how they did that is something you may be curious about. Next slide, please. The Eastern Oregon Workforce Board is just now starting their own sector partnership in healthcare. So if you have questions about how they're launching this, what it looks like for them, what employer partners they have, or if you want to offer your 2 cents on what they should consider out there in Eastern Oregon, feel free to reach out to me or Daria. I know Daria has already been kind of engaged with Eastern Oregon Workforce Board on helping them and supporting them as they launch this project. Lane Workforce Partnership has had 27 healthcare businesses engaged in Lane. What? Okay. And this is, I will say that this is data from the January to March reporting period. So my information is from March 2026. Just FYI. Probably should have said that. All right. So they're focusing a lot on that clinical placement mapping. So what does that look like for them and how are they actually meeting employers where they're at? That might be interesting to you all since you're interested in clinical placement issues. Next slide, please. Northwest Oregon Works has engaged 15 healthcare businesses, and they're focusing on CNA, medical assisting, and behavioral health pipeline development. So what does that look like for them? Might be a question you have. And they're targeting placements with 70% retention, which is a big deal. Like, how do you retain employees? Maybe a question that you have, and they might be able to speak to some of that. Next slide, please. Rogue has engaged 48 healthcare businesses. They're focusing on youth internship. They have a Careers in Gear event that's really pretty cool, kind of like a job fair situation, but on a much more grand scale. And they are involved in the Rural Healthcare Transformation Grant. So if you're wondering how they're involved in that, that might be a question we could address in a different meeting. All right, next slide, please. The Southwestern Oregon Workforce Investment Board has engaged 29 healthcare businesses. They're kind of reestablishing their sector partnership, so that's why you'll see re-engaged there. they have created a new surgical tech and medical assisting apprenticeship. These are registered apprenticeships with BOLI. That's pretty cool. If you'd like to learn more about what their surgical tech apprenticeship looks like, that could be something addressed in a future meeting as well. They're very open to sharing their information on what was approved by BOLI, what standards were approved, and what their master agreement looks like. They're very open to that information and sharing that and being a partner. All right, next slide, please. Work systems, I'm going to be like so mysterious in this slide because work systems is here today to share this information with you all. So this one I'm just going to leave pretty high level so that they can share more about what they're up to. Since this is their this is going to be their time to share. So we're going to skip right over this one, to be honest. So next slide. Willamette Workforce Partnership has engaged 99. I wish it was 100. I don't know. There's something about 99 that's like tickles my brain. But I wish it was, 100 so I can say 100 businesses engaged. But they're expanding their own behavioral health consortium as well. So they're having this regional conversation about behavioral health, bringing employers to the table, figuring out what training providers need or what employers need and how training providers can meet them where they're at. I think one thing that's really interesting about them is that they're helping to address the financial and workforce instabilities. So what that means is helping people get to work, those wraparound services, helping people get childcare, helping people figure out what they need to actually engage with work. And that's pretty fascinating. Next slide, please. So again, would it be valuable to have specific local workforce development board sector programs share in more detail about their initiatives? Would that be helpful for you all? And which boards would you like to hear from? You don't have to answer this right now because Daria is here. She's a resource for you, and you can reach out to me too and share who you'd like to hear from. Then I can help kind of coordinate that and they can represent themselves up here, which I feel like is really important for the people who are doing the work to speak to the work. And then what questions you have about sector partnerships. Again, you don't have to answer these out loud right now, but I would like it if this was something you all thought about and then how to engage at the more local level. I think you guys might add some flavor to your projects that you're working on now.
Thank you, Jen. Also, Jen, you know that it was a hybrid meeting. You could have joined online, but I know that with you, thanks for coming, being slightly sick. I know with Jen, though, we don't just get expertise in the room, we also get a little bit of entertainment. So this is always encouraged. Thank you, especially for long meetings. Sabrina, I know you joined us online as well. So could you please speak some more detail to the workforce partnership and specifically your workforce board to share? And I see that we will be short on time for questions. So right after that, you know my contact information, and Jen is still in the room. You're welcome to connect and then ask more questions and also engage with me for future questions and presentations. Thank you, Sabrina, your time.
Thank you. And I'll start by saying anybody who wants to reach out to me, feel free to do that. I'm going to do this as quickly as possible to respect the time and the schedule. My name is Sabrina Van Artsdalen. I'm a senior project manager at Work Systems. I've been there for 15 years. Prior to that, I was actually at the Oregon Employment Department as a manager of the Willow Creek Workforce Center. So anyways, have lots of workforce background. I currently am the lead for healthcare at Work Systems. So thanks, Jen, for setting me up. You did a great job. So at any one time, well, first let me start a little bit by saying we have a strong partnership. It's called CWWC, which stands for Columbia Willamette Workforce Collaborative. It's a partnership. Work Systems is responsible for Multnomah, Washington County. The CWWC brings in Clackamas County and also Southwest Washington. So very strong board there. We do almost everything together because we realize that is our labor market and our employers cross the river and our workers cross the river. So we have a really strong relationship. So almost a lot of the things I talk about are things that have come out of that collaborative, actually. At any one time, we have about 130 employers on our roster, but at any one time, there's about anywhere from 40 to 60 that are currently active, and it depends on what's going on. It depends on grants that we have. It depends on money on the table. It's easier to get employers to the table if you have something to offer them, like funding for training and things. Right now, two of the projects that we have in healthcare, one of them is with HEC. It was a grant that HEC gave, awarded to work systems to train 100 behavioral health professionals in peer support. Our first cohort's taken place, 20 graduated. Let me take that back. 19 originally graduated, and then we had a straggler, so we're at 20 now. So we have 20 graduates. They were given a stipend at the end of training. Stipends are one of those things that are kind of controversial and don't really like to give them up front because you'll see a lot of people take the training for the wrong reason. So we offered the stipend at the end of training after they were certified. So 20 started and 20 made it through. I'm really excited about that. Employment's still rolling in, but we've got, I think, 11 that have already started working out of the 20. We do hiring events. We have career coaches that support them. It's a pretty exciting program. It actually, this grant was a sustainability grant. We trained 80 last year in peer support. Our trainer is the Peer Company, also known as Medical Health Association of Oregon. But last year we trained 80 and it was a very successful program, but we learned a lot. So we added the stipend to it. We included Clackamas to broaden the rural and more diverse populations. In Multnomah, Washington County, we have some rural areas, especially out in Washington County when you get out really west. But for the most part, we don't have a lot of rural in Multnomah County. So we brought in Clackamas to kind of reach out more to those rural employers and those rural job seekers, and also diversity. We also offer the training in Spanish. The flyer is available in English and Spanish. And it's a 2-week, it's an 80-hour course. This training was driven by employers. So we have an advisory committee that gets us through the program, but they also designed the program 2 years ago. And they added some curriculum. We kind of call it skill development curriculum. So there's a week of skill development curriculum before we actually get into the training. And it digs deeper into the things that employers said were some of the problems. Suitability was a big issue and retention was a big issue. So this training that was developed kind of addresses those two concerns, and we've had real success with it. So we're pretty pleased with that. The grant runs until the end of March of 2027. We're on target to have at least 100 trained. So we're really excited about this program. Employers are very supportive of it. And so that's one of the things we're doing. The other thing that right now we're doing is we have a partnership with BCT Partnerships to train EMTs. So we are doing some EMT training. I think it's 100 in the next 2 years. And our work systems participant is to outreach to businesses, to get in businesses to hire the EMTs, but also we do a lot of outreach through our aligned partner network. We have about 40 aligned partners, mostly CBOs, community-based organizations that reach out to their populations. And so far we're doing great. We have 20, I think, starting at PCC, I think next week, if I'm not mistaken. But another successful program. And again, this was employer driven. Work Systems doesn't really get involved in trainings unless they're employer driven, because you have to have employers at the end of the training to hire all these people, right? So we really make sure that our trainings are employer driven. Let's see, we have a very strong youth department at Work Systems. They do a lot. They run a summer program. As a business service specialist, what I do. I specialize in reaching out to the community and organizations and businesses. So my job to help youth out is to find organizations in healthcare that would be willing to give youth opportunities. Oh, and let me go back 1 second. I forgot one thing about the peer support training that I think is really important. Not only this time around did we extend the geographical area, but we also partnered with United We Heal to have apprenticeship attached to the end of the training. So there's opportunities for these certified peer support people to actually get into apprenticeships. So that was a new thing that we added kind of as a continuum, because we felt like the last time we needed to expand on the geographical area, and we also needed to expand on the pathways. We talk a lot about pathways, as Jen mentioned. Work Systems is big on having pathways to our trainings. We don't ever want to train somebody in a dead-end job. And that job could be the end for that person if that's what they desire, but we always want to make sure that there's potential to move forward in that pathway. So I wanted to talk a little bit about that. We also are very strong on trying to create incumbent worker training. So this is what I hear from businesses. Why don't we have funding for incumbent workers? That's where we should invest our money. They're proven employees. They've been there. They've proven themselves. They know the culture of the organization. It's a lot easier to train somebody that's internal and then hire back, fill back in through our system, through the workforce centers, than it sometimes is to get people trained from the ground up. And it's time constraints. It's finding the right person. And then again, making sure that they're in the right culture. So we are really working hard. About 5 years ago, we had a very large grant where we trained 240 incumbent workers at the 5 major hospitals in our area. Very successful program. Took people that English was a second language, took them out of service departments like culinary, environmental services, transportation, and put them into clinical jobs, medical assistants, phlebotomists, sterile processing, CNAs. Several of them actually went into nursing. Very successful program. And then use the workforce centers to backfill in those jobs. It was a lot of coordinating. I wish we had the money to do it again. When the program was great, we went through a lot of bumps, kind of figured it out over the 3 years. But great program, training supervisors that were going to be losing people, training supervisors that were going to be getting people, and maybe English wasn't their first language, getting them to accept that, understanding the value of having multiple languages, especially in a healthcare setting where people are more comfortable seeing somebody that looks like them, that talks like them. So it was a great program, but of course the funding goes away and then the program goes away. So we are doing a lot of resource development right now, trying to find grants to help businesses with what they're telling me they need. And then the other thing I'd like to say is we have really strong partnerships with our educators. Portland Community College. I know, Vern, you're on the call and you left us to go to Clackamas, but I remember working with you over the years to make sure that what I'm telling employers and what employers are telling me, that we're hearing the same thing from our educators. So our educators are ready. We understand their capacity concerns. We understand their lack of instructors. We understand the lack of clinical placements, and trying to partner with them to work on those things, because those are important to us doing our job. If the clinical placements aren't out there, I can train a ton of clinical people, but if we don't have places to put them, it's a problem. So it's the whole continuum that I feel like we're working with at Work Systems. I'm really excited to hear the things that the other boards are doing. I think this is amazing forum, Daria and Jen and everybody. Thanks for putting this together, because I feel like now with hybrid training and virtual training, we don't have to keep our training just to our regions any longer. We can share those out. If the funding allows and the need is out there, with virtual training and hybrid classes and hybrid clinicals and whatever, we are now able to cross our boundaries. We don't have to just stick in our own region. So really excited about this forum that has been created, and learning about what other boards are doing, and how I can help other boards and how other boards can help us. And then I think the only other thing I'd say is career coaches. We have, I think, 80 to 100 career coaches in our region at any time that work with these students to get them through the training, to support them with supportive services and, educational navigators and, whatever they need, childcare and whatnot. But that's kind of the rundown of what I do at Work Systems and where Work Systems feels our role is in the workforce system. But again, thank you. And feel free to reach out if you'd like and talk to me, because I'd love to find out in detail what all the other boards are doing and just kind of see if there's, opportunities to partner.
Yes, thank you, Sabrina. So the questions. So I know that our chat is live right now. There are questions asked of Jan, and I'm sure Sabrina, you'll get some questions. But as we think about today and what we've heard, Sabrina has over 20 years of experience. So what she just mentioned is just a little bit, a glimpse. We've had multiple meetings, and there is much more that you can learn and understand how their workforce board works. So please do reach out to both Jan and Sabrina. If it's easier for you, you can let me know and I'll make those connections as well. Thank you.
Thank you. Thank you. Great presentation, Sabrina. You talked about the concept of suitability being a factor as well as retention. Can you talk a little bit more about what suitability means?
Yeah, so as it relates to peer support. So peer support, to be eligible to be a peer support specialist, you have to have lived experience, and that's such a broad range. It could be, you could be in recovery, you could have eating disorders, you could be taking care of somebody who has mental or behavioral health. It's a wide range. But once you've self-identified as having lived experience, then you can go into the training. The suitability part comes in, for instance, if someone is in recovery and maybe they're not where they should be to be actually delivering peer support services. It's really easy for someone in recovery, if they're not to that point yet, to fall back into substance abuse. So that's a big thing. Ethics is a huge thing. One of the large reasons that a lot of organizations lose a lot of their peer support is because they become personally involved with the person they're doing peer support with. It's a commonality, they can relate to them, they understand what they're doing. So suitability means they're in a good place in their life, it's a good culture for them, they're actually doing the support to the community and the population they want to serve. You may be a youth in recovery, you may be a youth with another type of lived experience and you want to work with youth, or you might want to work with homeless. So it's really finding the right culture for you and making sure you're ready to do it. So some of the skill development training that we put in place was dealing with ethics, like what you can and can't do, what's ethical, what's not ethical. Are you really in a safe place to do this for your own self-care, and those kind of things. So that's kind of what the suitability means.
Great. Thank you for asking that question. Thank you, Sabrina, once again, and thank you, Jen. We will be moving on to the next item. And so for us to understand how we respond to an issue, we first need to understand what has changed, right? So right now we will jump a little bit more deeper into those insights, and we will start with Max Sprague joining us online from OHA Focus Team, HR1 Focus Team, followed by Denise and Elijah from OHSU. We're ready, Max, for you.
Hello, thank you. Can you hear me okay in the room?
Yeah.
Awesome, excellent. Thank you all for having me this morning. My name is Max Sprague. I'm the Communications Director for OHA. I'm going to talk a little bit about HR1, the impacts and what we're doing. I will start with with two caveats. First, I am the communications director, not our policy person. Some of this stuff is still up in the air. And so if you have specific policy questions, I'm going to give a really high level overview and then really go into kind of what we're doing to help address this and what role you could potentially play in helping us with making sure that people stay covered and minimizing these impacts as best as we can. But if you do need other further questions or really in-depth policy questions, or even just to reach out to us, please feel free. I will provide some information and some ways to contact us. And so we are always available there. I also want to add that you'll notice that a lot of this stuff, as I'm going over high level, some of it is still a little bit fuzzy. Unfortunately, that's because many of the details when it comes to some of these things like work eligibility and what counts as medical frailty and how someone would do self-attestation, all of these things are still sort of being sorted out at the federal level, which is not ideal. It's not great. However, we don't want to wait until those things are fully sorted out to start engaging folks, because if we wait, by that time, these impacts will already have started. We need to start building these muscles now, especially as we consider ourselves as a network to help people and to get this information out and to protect folks. So I will dive in. We can go to the next slide. Thank you kindly. So like I said, I'll go into kind of what the Oregon Health Plan is, just a quick overview, an overview of HR1, how to stay informed, and also how we're going to help people. Next slide. Next one. Thank you. All right. So what is Oregon Health Plan? Oregon Health Plan is essentially Medicaid. It's the same thing. Whenever you hear something is going to impact Medicaid, it's going to impact OHP, right? So OHP provides healthcare coverage to people from all walks of life. This includes seniors, it includes children, it includes pregnant adults, single adults, and crucially working families. So of course, I'm sure either y'all know somebody who is on OHP, or your TAs are on OHP, or people you work with, or your students. This touches a lot of people. We're very lucky in Oregon to have such a broad healthcare system. It covers things like medical, dental, vision, prescriptions, behavioral health, in-home health, many other services. Usually members are covered through coordinated care organizations, CCOs. Some of them may have open card or fee for service. You may hear that term. Groups like Healthier Oregon, these are Medicaid expansion groups. Again, we're really lucky in Oregon to have so much different and diverse coverage for different groups of people. However, because of that, these impacts are really going to be felt. And anyone can apply at any time of the year. Next slide, please. There are a lot of reasons why anybody might need to be on Oregon Health Plan. Like I said, it's good, we encourage it. There are a few reasons: people who have qualifying income or who have had a sudden change or loss of income. So if you've lost your job, you decided to go back to school, you may have joined OHP. A life-threatening diagnosis. So obviously, as we're thinking about these changes, we're thinking about people who are currently undergoing care. So imagine that you are currently dealing with something like a cancer diagnosis, and suddenly you have to deal with more redeterminations or worry about work eligibility. It's a big deal. Need for home and community-based services. So folks who do need income in-home care, intellectual or developmental disabilities, and substance use disorder. Next slide, please. So our mission is to make sure that all people in Oregon can live healthy and prosperous lives. Sounds like a tagline, but it isn't. We are an agency and a group of people who genuinely, truly, and sincerely care about making sure that people can access the healthcare that they need. When people can access healthcare, we know that it has major ripple impacts across communities, right? I don't have to sell y'all on that. When people can get care, they can keep jobs, they can get preventative care, we can make sure that things don't spiral. It has a huge economic impact. We want to make sure that people in Oregon are staying covered. It means that they can manage their long-term health conditions more easily. They can stay connected to their doctors. They can get care early before small things turn into big things. We cover the costs of healthcare by providing people with access to preventative care, which reduces the need for things like emergency services, saves money, and all of that. Next slide, and then the next one. Thank you. And I do apologize that, like I said, I'm moving fast, but I'm well aware of our time. So our goals are, as I said, we want to keep people covered. We want to first acknowledge that HR1, also known as Big Beautiful Bill, working families tax cuts, that sort of thing. The federal bills that were all passed in last July, they are a departure from Oregon's goals, quite frankly. We are concerned that people are going to lose the protections that our state has set up to keep healthcare within reach. And every corner of our healthcare system will likely be impacted. And I want to be like really clear and kind of sit on that, because it's a big deal. Not only are people going to lose coverage, but there will be knock-on effects, right? When people lose coverage, it means that is fewer people who are paying doctors, particularly in rural areas. This can have impacts on the number of folks who are accessible, the affordability of the healthcare, the availability of the healthcare, and of course to all the different institutions who rely on these patient bases. I also want to recognize that there's going to be a lot of information in what I'm presenting. Our approach will be to follow the federal guidelines, but also to try to maintain coverage for as many people as possible who are eligible and to the greatest extent possible. So keeping people covered is better for everybody. We want to do that. I also want to emphasize these are federal requirements. These are not things that OHA decided to wake up and just do. We would not do that. But because these are the feds, we all understand this environment. We're going to have to follow them. We're also going to do everything in our power to make sure that people stay covered. We also are remaining focused on equity and access to care. We know that times are uncertain. We don't want to add to that. We also know that by having to implement these different requirements, we are going to be part of administrative burden for folks, for our partners, and for the people who are involved in us, who rely on us for these services. So as you can imagine, this is why we're trying to do so much prep work early. Next slide, please. So here we go. What are the new federal rules that are going to require major changes? HR 1 and other federal changes introduce new federal rules that will require big changes to the Oregon Health Plan. These will impact how, when, and where people in Oregon are able to access healthcare and other critical services. Some of these changes will include introduction of work or activity rules for some adults. I want to stress activity rules can also mean things like being involved in work training programs. It can mean being involved in studies and student programs. So there are some areas where we could potentially highlight opportunities for people, and I'll go into that a little bit more later. It will also cause changes to non-citizen eligibility. You may have heard about Healthier Oregon and some of the shifts we're going to have to do. There are new federal changes that limit who we can provide Medicaid care to, or how we can use expansion populations, or who is allowed to access these services. Obviously at OHA, we believe everyone, and I mean everyone, yes, everyone deserves to live a healthy and prosperous life. That is our goal. That's what we believe. So we want to make sure, however we can, we are continuing to extend some kind of care to people. It's just better for everyone, and it's the human being thing to do. Also, we have a shorter window for retroactive coverage. We have the introduction of some co-payments for some services in 2028. That is a long time away, but we are already looking at these things because, man, the impacts of this bill, I can't emphasize enough, are going to be felt for years. This isn't going to be a one-time thing. It's not going to be one kind of push and then we transition and it's good. We are going to continue to feel the very physical and economic impacts of this for quite some time. Also, we will have to do more frequent renewals. It also requires changes to provider taxes, state-directed payments, changes to Marketplace, to SNAP. You may have heard in the news that our colleagues at ODHS are already having to grapple with these work requirements. It is a huge impact. It's causing people to fall off of the program. People have less food security. It's rough. Next slide, please. Okay, so this slide and these slides will be available after this. This shows a timeline of the changes for the Oregon Health Plan. So right now we are really focused on a couple of different major milestones that we know are coming up. As I said, this is a long-term thing. So in October, big things will be some immigrants. Those are the folks that I talked about, the eligibility, right, for non-citizens. Some immigrants will be moving to our Healthier Oregon plan. Some members will start to receive notices about meeting worker activity rules. We're going to send these out early, and we're going to try to use as many channels as possible so that people can receive this information. This is a big deal. I mean, obviously the whole thing is a big deal, but making sure that people right now and in the next few months are keeping their contact information up to date with us, that they are reaching out to channels or finding ways to make sure that their contact information is up to date, or that they can receive messages from us so that they can be aware of when these work rules or activity rules are going into effect. That's really big right now. If there's one thing I can leave you with, it's please, if you know people who are going to be impacted this, if you suspect people are going to be impacted this, the biggest thing you can do right now for us or to help us is to make sure that people are updating their information so they can get this info from us, right? And this is going to be extra challenging. It's going to be challenging because people speak different languages, because people have different ways of receiving communication. Some people are housing insecure, right? And so getting this kind of information, it's going to be a trick. Also, there are people who, for I would say pretty decent reasons at this point, are pretty reluctant to engage with government agencies. They have low trust in institutions like us. There are a variety of reasons for this. There's a lot of confusion and misinformation out there. So working through trusted messengers like all of y'all will also be very important. And again, I'll kind of go into that a little bit more in a sec. In January 2027, work or activity rules will begin for some adults. This is the big date, right? This is the go live. This is also why we're a little nervous about the fact that some of these details haven't been fully fleshed out. Boy, we are coming up to the wire on this, but it's such as this administration. I can say that as a former Fed, I can be a little salty. Don't tell anybody. Shorter time period for help for recent medical bills, so retroactive coverage will begin to shorten. Healthier Oregon members will move officially to the OHP open card. So January is going to be when all the really big shifts happen, right? Late 2027, we'll see more frequent renewals, continuous eligibility rules in for adults and change for 1 year for children. We also have in October 2028, some adults will begin paying a small fee or copay for some services. These are the big milestones. I will add, if you have more questions about kind of what these things will look like or what we know right now, on our website at OHA, we have things like plain language FAQs. We go into detail. And like I said, you can always reach out to us. Next slide, please. So ways to meet the OHP worker activity rules. This is what we know right now. And again, the official notice for some of these things just came out at the top of the month. We are still going through it because it is several hundred pages that say a lot of, not a lot. But so this is what we know right now. Some, starting in January 2027, some adults age 19 through 64 who do not qualify for an exemption, we are still looking at what folks would count as an exemption. Unfortunately, exemptions have been really narrowed as well under the new federal administrative rules. But they will need to meet OHP work or activity rules by showing one of the following: a household income of more than $580 per month. They're in high school, a GED program, or at least half-time enrollment in higher education. So big thing to remember, or at least 80 hours monthly of work, education, training, programs, or volunteering. There were some different there were drafts that were coming out early that also talked about like bartering and things like that, to give you a sense of things are kind of wobbly here, but these are the big things. And obviously having access to half-time enrollment in higher education, having access to work, training, education programs, that sort of thing, volunteering even, these opportunities are going to be crucial. A big thing to know is that the majority of people who are on OHP already work. I think some of our estimates say that something like only 2% of people don't work or have some sort of like major disability that would allow them to hopefully remain exempt. And so when it comes to opportunities, we care about those. We want to make sure that people have those. We also really want to make sure that just what we know is most likely going to happen is that somebody, your TA or your student or non-traditional students, people who are currently in your workforce training program, they will do everything right. They will be part of this education. They will be trying to improve their lives. They will be undergoing substance treatment. They will probably qualify for these sorts of things, but they will be unaware of the changes that are happening. They may be unaware of where they can go to get help when it comes to the changes happening, and they may fall through the cracks due to the administrative issues. They will file the wrong paperwork, or they won't file the paperwork on time. This is what we're concerned about. We're worried that people are going to fall through the cracks in this way primarily. And so getting this info out is a big deal for us. Next slide, please. And then the next one. Thank you. So to stay informed, as I said, we have a webpage for changes that are coming up soon for HR1. We will also be standing up a partner resource hub along with our colleagues over at ODHS. This hub will have resources available like partner toolkits, translated information, flyers that can be put up, that sort of thing, information that people can use or can disseminate or help us with, excuse me, so that way we can get the word out, and that's going to be pretty big. We also have a newsletter, Oregon Health News. We have social media that you can follow, and of course you can always reach out to us. So that is kind of a very quick, very high level overview of HR1 and kind of who we are and what we are looking at currently. And to speak to kind of beyond just the basics of this, I really do want to land on that human impact that, we are staring down federal changes that are going to change lives in a very real way. And we are also staring at those things currently, to be quite frank, with no resources. We were really not given much to implement these changes. There will be major administrative changes on our side, right, to process all of this redetermination stuff. You may be familiar with the unwinding of COVID. Those years. I wasn't at OHA during that time. I was a Fed during that time. But I understand that we had a lot of resources then to get information out to people, right? Bus wraps and PSAs and that sort of thing. We are working on I would say, far more traditional government shoestring budget this time around, right? So we are currently doing all that we can to get the resources together, but we are really going to depend on, I think, or if not fully depend on, that's probably the wrong word, but certainly heavily partner with folks like y'all, people who are trusted messengers, who are hubs in their communities, who are part of networks like this, who can help people get this information, who can help us as well identify opportunities and move people towards them. This is going to take everybody. It is going to be a big deal. It's going to be a big deal across the nation. We're watching other states currently at the moment really struggle as they start to implement these work requirements early for folks. They are just kind of taking the approach that folks will fall off, and then if they really care about healthcare, they'll jump back on the wagon at some point. That's not the approach that Oregon wants to take. We want to do what people in Oregon always do, which is come together and help folks, right? We are really, really, really good at that. And I know, having worked with some of the folks in this room, that you all are really good at that too. And so I will pause here. I can't see the chat, I don't think, or maybe I can, but Zoom is being touchy about it. But I'm happy to take some questions. Again, when it comes to the deep policy stuff, I may have to refer you to our partners, but or not partners, my colleagues. But I'm happy to talk more about, if it would help, kind of how we're envisioning things. I can wax poetic about synergy and hub and spoke models if that would be helpful. But primarily, like I said, the big things that I wanted to leave you with today are the changes are coming. We want to make sure that people are updating their contact information, because that's really important. We want to make sure that they do get this information. And we will be, particularly as we move towards January, and especially you'll see like around August and September into October, we will be really engaging our partner networks. Trusted messengers are going to be huge to make sure that people get the information that they need to stay covered and are aware of opportunities that will help them stay covered. Thank you.
Mm-hmm. Thank you, Max. I know that we have questions in the chat. Max, if you could please stay and answer those questions in the chat right away. So in order for us to continue, kind of take questions right now. Thank you very much, Max. Denise?
Good morning, everyone. It's great to be here. I'm Denise Dahlman, Assistant Vice Provost for Workforce Capacity Development from OHSU, and I'm here with my colleague who is online, Elijah Herr, Director of Financial Aid. And thank you, Max, for that presentation. That was very informative. I wasn't aware of some of those things, so I appreciate the information. I think you'll see a lot of parallels between Max's presentation and ours. We're going to be speaking about HR1 implications for Oregon's healthcare workforce pipeline, and specifically on HR1 impacts on student financial aid. And with that, I'm going to pass it on to Eli.
Hello, everyone. Sorry I was not able to join you today. We are in the middle of a disbursement event. I think you all understand as we move through these slides what that means for OHSU and why it is important that we make sure every dollar that we can get to our students now is happening now. So again, please accept my apologies for not being in the room today. Next slide, please. So HR1, Max did a great overview of it. It is a sweeping bill. It's an omnibus bill that was done through reconciliation. I will not bore you with what reconciliation is. It's a legal maneuver effectively that allows the majority in the Senate to bypass the 60 vote threshold required to enact laws. It has to be budget focused and budget neutral. And in order to set off very large tax cuts desired by the current administration, they needed to make equal cuts elsewhere. One of the big areas that they focused on was, for better or for worse, was higher education funding, and in particular, graduate and professional higher education funding. This is a bit of a reaction to the Biden administration's loan forgiveness, and a very strange position that institutions of higher education are somehow intrinsically opposed to the current administration. So with that, in order to make the money work, they had to cut a lot of money out of both healthcare and graduate higher education. So when they did that, they eliminated Grad Plus, and we'll talk about what that means in a minute. They also implemented a new loan proration strategy, which is not totally clear on the formula and calculations we're supposed to use on that. Max definitely, I think, presaged some of that or previewed some of that for you guys, in that we're working with rules that are under development and still being debated now. There's also several injunctions and other court cases that are currently in the works. So we really are operating in a very fluid environment, and this is the state of everything right now. If you hear me use the word OB3, the phrase OB3, that's one big beautiful bill. In the financial aid community, that is how we refer to HR1 often. So it is a little bit of an industry art of term, and I may slip into that, but don't be confused. That's what it is. And there is a note here that says the burden shifts from federal to state to individual students. That's a little bit of a misnomer. Students were still sharing the burden in that these are loans that went from federal loans in many cases to private loans. And again, we'll talk about that in a second. The nature of the obligation for the student, though, has dramatically changed. With many protections provided by the federal government and the federal lending system no longer available in the private loan market. And while some of these take effect July 1st, 2026, it is a moving target again, in that these are being phased out through a thing called an interim exception that, under certain conditions, allows for students to retain access to the old system as long as they walk a very, very tight rope in maintaining their eligibility, and a few other arcane reasons for them to retain their or to have taken out a loan for their program of study, wherever that may be, and in the program they may have been. So July 1st is an important date, and we'll talk about what that means in a little bit. Next slide, please. This matters for Oregon. This matters for Oregon in a massive way, because it will directly impact every single healthcare United Allied Health program in the state. Anything that is a little bit more expensive or dramatically more expensive will be impacted. And that's going to change the incentive structure for people entering into these programs. And as we know, Oregon has a healthcare crisis. Most of America has a healthcare crisis in terms of finding trained and competent workers to work in our hospitals, especially in our rural hospitals. And this disproportionately impacts rural and underserved communities. And that's largely due to market effects based on return on investment. What is it going to cost in order to get this education? And then where do I have to work in order to be able to earn the salary that will allow me to repay it? It's a very sobering set of socioeconomic factors that clearly disincentivizes healthcare professionals from working in rural and underserved communities. I would say that there is I wouldn't even call it a potential misalignment. I would call it a potential, a clear contradiction in state workforce and equity goals. As we know too, and again, we'll talk about this briefly later, when we push students into the private loan markets, what we see is the access to capital, that is the ability to borrow a private student loan, tracks very closely to other socioeconomic indicators based on country of origin, nationality, race, gender. These things all kind of show up in the data and who's able to take out a private loan. Next slide, please. So what does HR 1 do? It does not eliminate subsidized for undergraduate loans. What it does, that is currently a proposal by the Senate House Committee on Education. They also have proposed eliminating federal work study. They've also proposed eliminating a thing called the Supplemental Educational Opportunity Grant, or SEOG, which is a grant that goes to provide additional support for the most impoverished students. Those have not been passed. They've come up before. I don't know if they will. I don't have a line on where that's at in the legislative tracking, but it is being talked about in Washington right now. What HR 1 does do is it does eliminate the Grad Plus loan. And it dramatically changes, and we'll talk about what that means for OHSU. It is a very stark reality for our students and for our institution. It also changes the loan caps. So these are the ability for students to borrow both annually within their program and lifetime limits as well that are now imposed. That when I say a lifetime limit, I mean that if a student hits that limit, they will be ineligible to borrow any federal student loan ever again. They will not be able to discharge them due to disability. They will not be able to pay them back and then get more eligibility. They are officially removed from the federal, removed from accessing the federal loan system. There is a rule called the Schedule of Reductions, also known as proration, for students who attend less than full-time. Less than full-time is defined at the institutional level. For most of our colleges and universities in the state of Oregon, undergraduate full-time is 12 credits at least per term. And for most graduate programs, not all, but most, it's 9 credits per term. So if students take less than that in a year, and we'll talk a little bit about the calculation, it's a very confusing annualized calculation, their loans will have to be reduced. There are also changes to repayment terms, and this has created a very confusing mixed system in which we've gone from one set of already confusing student loan repayment options to now 3 sets of dominant student loan repayment options. And then there's a limited legacy provision. Again, I mentioned that prior in the previous slide, that if students hit a very narrow set of requirements, they can retain access to the old system, including Graduate Plus loans, for up to 3 years, or a very confusing concept called their expected time to credential. Discussing and explaining the expected time to credential would take probably about 45 minutes, and I'm sure you would have lots of questions. But effectively, the highlight is that it's the amount of time that the Department of Education thinks it will take your student to complete if they go full-time based on the date that they matriculate into the school. That sounds straightforward. It is not. Next slide, please. So Graduate Plus loans. So this is a big piece of financial aid at OHSU. About 30, depending on the year, between 30 and 40% of all aid that we issue is a Grad Plus loan, meaning between 30 and 40% of all of the financial aid that students, and that includes scholarships and grants, both at the state and federal level. Those dollars are now in jeopardy for our students. And it is the gap between student loans and all other sources of aid. It's the thing that fills in the in between, right? Between what we can give them, what they can borrow in other loan programs, and then the actual cost of attendance. It is important, I think, to pause for a second and talk about what the cost of attendance means. That is a legally defined term in the higher education space. It includes tuition and fees. That seems obvious. It includes books and supplies. It includes exams. So any kind of certification or anything that people need to be able to practice in the state of Oregon, all of those charges are included. It also includes housing, food, transportation, and basically everything that you need to be able to live while you attend school. Before the OB3 bill was passed, our annual survey indicated that 50% of our students were already food and housing insecure. We have not run a survey on that topic since, but we are certainly paying close attention to that, as those dollars are the dollars that come when the student, those dollars are covered by the student's disbursement after we've paid their tuition and fees and other institutional charges. So when they cut the Graduate Plus loan, what they're really cutting directly is housing and food and transportation, the ability to subsist while attending school. Next slide, please. Again, this is just to give you an example of what it looks like for OHSU in terms of dollars and practical impact. This is from the 24-25 academic year, $28 million in Graduate Plus loans. So that's 41% of our students, both our graduate and professional students, receive a plus loan. I mean, this is a massive piece of what we do. We have expensive programs because educating a healthcare workforce is an expensive proposition. It requires a lot of expertise. It requires decades of training from faculty, and it requires very expensive labs, simulation labs, labs to do blood work, and specialized classrooms that simply cannot be shortchanged. It costs what it costs. And the average, to give you just to really bring it down to like what it means for an individual student, the average individual student now will lose almost $38,000 a year in funding. So they're going to have to find ways to replace that. And when I say they, I mean us as well. We are actively working on what we can do to mitigate this, but it is a massive hole to try to find nearly $30 million a year, every year, from now into perpetuity for our students in the healthcare pipeline. Next slide, please. So the Department of Education also took a very, very strange turn in making a distinction between a graduate and a professional degree. This is a regulatory sort of hot button. It's under multiple lawsuits at this point. The definition is capricious and difficult to defend, but it is currently the rule as promulgated and what we're currently acting on, though we expect there to be some legal movement in this particular area. Graduate students, these are graduate students who are in anything, at least at OHSU, and we'll look at a discrete list in a second here. Any student that is not in an MD program or a DMD program at OHSU or a Psych D program will be facing an annual limit of $20,500. Okay. In some cases, that is a reduction from $37,000, and there's no graduate plus for these students to be able to fill in that missing dollars from the unsubsidized reduction. For professional students, so in our case, this is our MDs, our DMDs, and our Psych Ds, they're allowed $50,000 a year, but there's an aggregate cap of $200,000. Just for reference, $200,000 is about half of what it would take to cover the MD program at OHSU. That includes living expenses, transportation, food, and other costs. And now there's a lifetime loan limit. And I did mention this in my previous slide, that these students, when they hit that $257,500, the door swings shut and there is no more access to federal aid. That is it. That also includes undergraduate borrowing as well as graduate borrowing. Next slide, please. So these are the programs that are expressly excluded currently from the Department of Education's definition of a professional program. This is not an exhaustive list. We will look at a semi-exhaustive list on the next slide, but I do want to highlight the importance of these. So DMP, all flavors of DMPs, nurse educators, physicians associates, public health, physical therapy, medical physics, ophthalmology, optometry, anything that is, and this is also includes other non-health programs like architecture, social work. These programs have been labeled as secondary and non-professional. They are graduate programs and are subject now to strict loan limits, despite the definition of a program. These programs meeting the legal definition, but not the regulatory definition as the rules promulgated by the Department of Ed. there's about 300 pages in the final rule that was released in which Ed attempts to defend this decision. These are, to my mind, I'm not a lawyer, but these are dubious arguments, and judges and legal professionals have flagged them as such. Next slide, please. These are the current healthcare professional programs that are allowed the higher annual and aggregate limit. As you can see, this is, these are important programs to be certain. This list is also incredibly finite in terms of the scope and need of our healthcare workforce, both in the state of Oregon and at the national level. Next slide, please. So loan proration. Students, so the way that loan proration works, and this is a formula that is exceedingly complex. And when I say exceedingly complex, I have, I've worked in financial aid for almost 20 years now, and I have never seen something that does this. It's very weird. It's a very strange interpretation of the law passed by Congress. And it seems to be maximizing the ability or the requirement that we reduce loans for students. Potentially, if a student drops or doesn't complete their course in a prior year or a prior term, they could have future term aid reduced for not completing. So it's not even a matter of not attempting a course or registering for a course. It's completing courses. Now at OHSU, we have the benefit of having a pretty low attrition rate. But when you start talking about community colleges or access education institutions like Southern Oregon University or Portland State, you're going to see enrollment patterns where where students often drop courses after they've already received their financial aid. This is going to create all kinds of mischief and mayhem for those students being able to even stay in school, let alone have funding by the time they get to the end of the academic year. Students who enroll part-time may have their loans reduced, but the calculation for reducing loans happens at the annual level. So an individual student may be able to attend part-time in a single term, but their classmate in that same course or in that same course or in that same program may not be able to take enroll less than half time, depending on what they're doing in other terms. It creates lots of confusion for students and disproportionately situates them vis-a-vis enrollment in a particular term. And this is the thing that I think is a true travesty, is that there is no protection for students who have an ADA accommodation or allowed to have a slowdown and enroll in fewer credits, or somebody who has an emergency, a medical emergency, a death in the family, something that happens in their life that they have to withdraw. There are no protections for those students. They are subject to the schedule of reductions. And if they continue to have issues term over term, particularly with our ADA students who have a legitimate reason to have a curricular slowdown, there is no protection for them. Their aid must be reduced. And there are no alternatives in Grad Plus, especially at the professional level, at the at the postgraduate level, to be able to protect them with other loan funds. Next slide, please. Okay, the repayment terms, what I think is interesting about this slide is they're both, while this says there's fewer repayment options, there's also increased repayment complexity. Those two things are sort of like, it's very difficult to hold both of those kind of in concert with each other. What I will say is that if you're a future borrower and you're an OB3 future borrower, and all you've done is ever borrowed under the OB3 rules, your repayment options are significantly simpler. But anybody making the transition or anybody who has a loan that's prior to the OB3 implementation, they're going to end up with what I call a tripartite repayment system. They're going to have some loans that will be in the old system, which is exceedingly complicated. Some loans that will be under the new system with a completely different set of rules. And then some loans that are going to be in a vastly expanded private loan market that have their own set of rules and will vary dramatically from lender to lender and have no set sort of course of reference for what these terms mean. What do I sign myself up for? How do I get out of it? And how do I refinance it? There's also changes to public service loan forgiveness eligibility. The Department of Education has promulgated a very strange rule that has no legal support, again, based on the actual statute passed by the Department by the U.S. Congress, the legislature. It gives the Secretary of Education the ability to discount, like that, to not count payments made towards public service loan forgiveness if the Secretary of Education determines the organization that the student is working at is engaged in they're calling a substantial illegal activity. Not an illegal activity, a substantial illegal activity. As you can imagine, this is already under litigation. It's a highly subjective law enforcement argument that basically deputizes the Secretary of Education, but it could end up for particularly hospitals like ourselves, where the current administration uses phrases like surgically or chemically mutilates children or castrates children under what we would call gender affirming care. They would say is reason enough for them to discount all of your payments and exclude the employees at those organizations from getting public service loan forgiveness. The list goes on and on. It's very, very strange and convoluted. And when we talk about the financial burden post-graduation, what we're talking about here is students who are not able to access Grad Plus, who are going to have to be pushed into the private loan market. The terms and conditions for private loans, we just did a whole market survey on this, are significantly less advantageous for our students and will result, again, this is not a firm and hard statistic, but something that we worked with our institutional research office on, looking at current market rate, looking at students who are going to pay between a 30 and 25 and 50% increase to tuition. That's what the cost equivalent would be. So it's not just the cost of attending, it is also the cost of repayment. The terms are very predatory in my mind, and a lot for students who are already in very difficult medical programs to navigate and to make the right decision with extremely high consequences, long-term and short-term consequences. Next slide, please. So a legacy provision, this is also referred to in financial aid world as the interim exception. Students can maintain the old system and the old protections as long as they've received a loan, so a federal loan, in their program of study. That means their program at their school and is defined as by their SIP code, which is a 4-digit, 6-digit, or 8-digit, depending on who you are, code that sort of classifies the program as something very specific. And it's at the same program level, meaning undergraduate, graduate, professional. As long as they've already borrowed a loan prior to July 1st, they can maintain access to these legacy provisions, to Grad Plus and the better loan limits and the repayment options for 3 years or their expected time to credential, which is this very strange formula that allows for some exclusions but not others. We're not going to spend a lot of time on that. Just know that it's there. However, if a student takes a leave, so that means they take a term off, they drop out, something happens, they exceed their expected time to credential, the number of terms that the federal government thinks it should take for you to complete your program, or they hit that 3 years, or they switch between dual degrees, right? So we have an MD MPH program. When students make the switch from one component of that program to another, they change their SIP codes and they lose access to all of those provisions. As you can imagine, anybody who's starting a 4-year program right now is doing so under great risk. They will have access to Graduate Plus loans for the first, second, and third year, but the 4th year, they are not, and they're going to be pushed into the private loan market, where hopefully they can find a cosigner and a lender who is willing to lend to them, where they will have 3 years of medical student loans and no degree to be able to pay it. It's a very sobering, very harrowing reality for our students, and they have to make those decisions now. Next slide, please. Private loans, again, there are some good lenders out there. If you do have to talk to a student, this is not an official endorsement, as I am legally required not to make endorsements or recommendations, but I would encourage your students, if they're looking for a private student loan to cover medical expenses, to look at state agencies, other state agencies, in particular, Massachusetts, MIFA, and Iowa, ISL. It's called the Iowa State Student Loan System. Both of those have dramatically better interest rates, way more student-friendly terms and conditions, particularly for residency, and other features that are contained in the current federal loan system. Private lenders, you can find good private lenders who are out there in the lending space. There are also a lot of really bad actors, and the market is incredibly fluid right now. Everyone is trying to figure out how much capital they can wring out of this new market. And I've seen interest rates as high as 18% for a student loan, for a private student loan, with a 10-year repayment window. And that 10-year repayment window begins at the first disbursement, not when the student graduates, nor when the student completes their rotations, right? It starts at when they're a freshman and they get their first loan. So you have a medical student who goes 4 years in higher ed doing their coursework, 3 years in residency. When they complete their residency and are finally able to find a job, they will have 3 years to pay off a 10-year note or refinance it at a much higher cost. These are the kinds of realities that our students are going to have to face, okay? There will be very few borrower protections, particularly the CFPB is currently not being well funded. This is the place that folks really get a lot of protection. Fortunately, Oregon does have an ombuds office for private student lending, which if you have students who have private loans and need some relief, that is definitely where to send them. They have some limited ability to help regulate and certify those borrowers. There is so much to cover in the private loan market. Again, we could do an entire hour on this, the terms and conditions and the predatory stuff that we're seeing being put in front of students. We at OHSU, and we'll talk about this after Denise does her portion of this presentation, have created a preferred lender list to help students navigate this emerging market, and it's incredibly difficult. Last thing I will say on this is the credit and cosigner requirements. If students can find cosigners, then they can get decent loans. But when we start talking about access to credit, right, what I mentioned before is it tracks along socioeconomic lines, right? So we're going to end up with whiter, more male, more socioeconomically wealthy students who can access loans. So more diverse, more gender diverse. DACA students will be completely eliminated from the ability to borrow because they're not technically U.S. citizens, and U.S. citizenship is usually required to take out a private loan. We're talking about a massive shifting away from the ability for to meet diversity, equity, inclusion, and belonging requirements, or at least mission requirements that we have at OHSU. It will be strong headwinds that we are currently trying to navigate. Next slide, please. All right, I'm going to turn it over to my colleague, Denise Dahlman, who will walk you through how all of that, those seismic changes in federal aid are going to impact our health professions, education, and workforce.
Thank you so much, Eli. I think the mood in this room is very somber. We had considered, do we want to share all this level of detail, but we thought it was important so that everyone could really understand the scope of the implications of the changes to federal financial aid. They are truly massive and are going to have a subsequent impact on our healthcare workforce. Yeah, please do.
I appreciate that we're going over, please. I know that this is off the agenda, but this is really important and going so deep into this, but I'm happy that this is going over.
I wanted to add, yes, thank you for making that. Then we do have that minute. Thank you.
But I appreciate that we're going.
I wanted to say that this is super important and super critical. Don't worry, Denise, just go with you. Do not skip a single slide. I'm seeing that everybody, thank you for making that comment. It frees me to say that now, yes, aloud. It is important. I want you to all be able to listen to this, to connect afterwards, to know that today, and then for folks online as well. We will catch up later on the time. This is fine. Don't even worry about the time. Yes.
Okay, thank you so much. Really appreciate it. So next slide, please. This is receiving national attention. I just wanted to share this quote, and this was actually from Senator Merkley's website. There's currently, as Eli mentioned, there are lawsuits related to designating specifically graduate nursing programs as they're currently designated as graduate. The hope is that they will be designated as professional so that they can be eligible for the higher loan limits. The Department of Education's regulations threaten to undermine the pipeline of nursing talent, and I will add many other professions, healthcare professions, that our healthcare system depends on, making it harder for nursing students to become the advanced practitioners, educators, and researchers America needs. Next slide, please. So where do we expect disruptions in the education to workforce pathway? The answer is along the entire pipeline. We are already seeing at OHSU, and I'm sure at all higher education, healthcare institutions, we are already seeing the impacts of this. We are seeing applicants who are we are probably not even seeing those who are now self-selecting themselves out of even applying to programs because they believe that they can't afford education. Applicants are asking questions, how am I going to afford paying tuition? I anticipate that we will see students who apply, they're admitted, they commit to attending, and then realize shortly before they're about to start, I can't afford this. I can't come after all. We're going to see students who apply, are admitted, they start their programs, and then somewhere along the way, for whatever reason, they have an emergency, they need a break, or they reach their 3-year limit, and then they're going to withdraw, which is even worse because now they have loans to pay back, but no degree to show for it. And then graduates are also going to suffer. As Eli mentioned, they're going to have higher repayment, interest rates, the list goes on. And then we're going to see all of that impact is going to impact our workforce. Next slide, please. And then, so not only are we anticipating impact on the number of students and learners coming through our educational programs, we also will see an impact on the diversity of our learners. As Eli mentioned, we'll have fewer economically disadvantaged students who enroll in our programs. Therefore, we will have less diverse graduating cohorts and therefore a less diverse workforce, finally resulting in disparities and equity gaps that will be worsened. Next slide, please. We also anticipate that there will be a shift towards higher paying specialties because students will have more loans to repay. The repayment terms will be stricter. They will have higher interest rates that will lead new graduates to be less likely to choose areas where we already have workforce shortages: primary care, pediatrics, behavioral health, nursing education, rural health settings, public health. Exacerbating existing shortages in these areas. Next slide, please. There is a lot of work already happening to help even before the implementation or before HR 1 was passed. There is a lot of efforts and a lot of work already happening to strengthen the healthcare workforce. I think we will really need to focus on building on those existing responses that we have, things like financial incentive programs, loan repayment programs tied to service in high need areas, scholarships covering tuition in exchange for workforce commitments. At OHSU, we have a scholarship called SHOE, and the state also has SHOE-like scholarships where students have their tuition paid if they commit to serving in a rural or underserved area. State-supported financial aid to reduce student debt burden, which Eli mentioned. Strengthening workforce pathways. We have many incredible workforce pathways already in Oregon and beyond, but strengthening those workforce pathways can help us resolve some of these issues. Career pathway programs, K through 12, community college to university to workforce. And then also we heard an excellent presentation at the Oregon Talent Summit, which Daria facilitated, grow your own models to recruit and train local talent. And then building on our training and education capacity, expanding clinical placements, residencies, and then supporting faculty recruitment, training, and retention. And then finally, workforce recruitment and retention, providing incentives for rural and underserved practitioners. We have through OHSU Office of Rural Health, we have a provider incentive program, which provides financial incentives for providers in rural health areas, and then apprenticeship and earn and learn models. So I really hope that our focus can be on solutions. I'm a very solution-oriented person. I know this is all very sobering information, but I think there's a lot of hope. There's a lot of opportunity and potential for us to make an impact. Next slide, please. I think everyone's probably very aware of the workforce shortages in Oregon, but just to give everyone a high-level overview, and this is from the Oregon Areas of Unmet Healthcare Needs report from the Oregon Office of Rural Health. In our rural and remote communities, up to 72% are classified as unmet need areas. Behavioral health, we're among the worst access nationally and have major rural gaps. In primary care, we have insufficient capacity outside of urban areas, in particular related to DNP, MD, and PA primary care providers. There are thousands of vacancies among RNs, CNAs, and aides. They're among the top vacancies that we have in the state. And then certain communities have 0 providers, such as primary care, behavioral health, and dental health, oral health. Next slide, please. So this is a map showing unmet need across the state. The areas in red, which are our rural frontier areas in Oregon, have the highest unmet need. So you can see these are the areas that really need our support. And with that, we're going to turn our attention to solutions. Eli is going to share a little bit about what OHSU is currently doing to mitigate these impacts, and then some suggestions for state-level solutions and areas of potential collaboration, building on existing things that we already have. I think the bottom line is, I would say, our students need money. That's really what it boils down to, is students need money in whatever shape or form it can come, whether it's scholarships, grants, stipends. I think that's what it comes down to. But collaboratively, we can work together and work on some solutions. So back to Eli. Thank you.
Thanks, Denise. Yeah, if we could get, we're going to talk about what OHSU has been doing, and please know, we in my division and my leadership, we've been looking at this train coming now for over a year, at least 14 months. So I do a fair amount of lobby work in Washington, D.C., and I'm pretty connected to the legislative process. So we had the benefit of having kind of an inside track and seeing what this is going to look like a long time ago. And we began laying the groundwork at OHSU, creating a shared sense of urgency, awareness of what is happening, what's going to happen, worst case scenarios, best case scenarios, and moving a very large institution forward in order to support students. So this is what you're about to see is our work thus far. We have a long way to go, but this is what we've been able to do. Next slide, please. So it's a little bit of a burying the lead here when we say earlier start dates. Rather, we went to the curriculum. We went to both our MD, DMD, PA programs, DMP program, and anybody else that would listen and said, hey, you have to redesign your curriculum for a single year and move everybody's start date for your incoming classes to start on June 29th. This is so that we can get as many students as we can into that legacy provision. Because remember, one of the conditions for that, to be grandfathered into that, is to have received a direct loan prior to July 1st, 2026, which is why, for all of you keeping track, is a scant 6 days away, which is why I'm unable to attend in person, is because we're trying to get money out for as many incoming students as we literally can. So yes, we moved the start dates forward, but this required significant curricular redesign across most of our programs to do that. And I really want to applaud our instructional folks who made that happen under a lot of duress, worked with our accrediting agencies, both at the state and the regional level, in order to get that over the line. And I am happy to say that as of this morning, we have released aid for incoming students for over 500 incoming doctors, dentists, and nurses. So graduate nurses, with another 300, I think, in the pipeline going out today. So again, this is a partial solution, and it buys them 3 years. It does not buy them all the way to the end of their program, but it gets them something. That's kind of our strategy, is how can we stay ahead of this? We spent 6 months with a committee, myself, that included instructional staff, folks from our financial literacy office, my leadership team, and disability services, scouring the emerging private loan market to determine what will be, what can we get for our students? What are the best deals that are out there, and how to avoid predatory products? That process was a 6-month RFI with lots of follow-up and lots of legwork. We certainly we launched that less than about a month ago. So our students that don't know where to go or where to start are at least have a starting place and are able to identify some of those better lenders that are out there. We felt we should do that. We needed to do that work so that the students we're asking to go to medical school don't have to do that work, right? We don't put that burden back on them, and we try to meet them where they're at. I will tell you that our provost is actively working with our scholarship office. We have done, the financial aid office and institutional research have provided lots and lots and lots of market research, which programs are going to be affected first, which classes are going to be impacted first, how we're going to identify them, what we're going to be able to do in order to get, to help with fundraising efforts. What are we going to target? How are we going to target it? And how are we going to bridge a $28 million a year gap? In addition to that, the university is bolstering basic needs and support and financial counseling support. So that's to help students navigate the private loan market, but also to be able to deal with those students who had to take a term off or something happened and now they're out of their legacy provisions and are going to be an immediate need to get them over the line. Some of the ideas that we're looking at are, last mile funds. Some of them are programmatic funds. Really, it's everything under the sun at this point to try to figure out what we can do in order to help our students stay in school, graduate on time, and serve Oregonians. We have always had, not always, for the last several years, we've had a tuition promise for all programs that we can, meaning we're not going to raise tuition for a student who's committed, right? We have to do our part both on the other side of the ledger, right? It can't just be all getting more payments for the students. We also have to figure out a way to contain costs. So we've done that through tuition promise, and we've done that through tuition minimalization. So while the promise guarantees the student will have the same tuition and fees throughout the course of their program, we also want to ensure that incoming students are not going to be hit by large increases in tuition and fees. We have, at least in my limited time at OHSU, this goes back 3 years, we have capped tuition increases to 2%, which is well below the inflationary mark and market for most of our peer competitors, and no increase to university fees. We also consolidated those fees to make them easier for students to understand, so that they understand that they can look at their account and know where their money is going. Next slide, please. I think this one's yours, Denise.
Okay. So supporting students to meet workforce needs. Eli, please feel free to jump in as well.
Oh, okay.
Yeah, or if you want to take this.
I can take this one. Yeah, that's fine.
Yeah, okay.
Yeah, no problem. No problem. Yeah, we're really looking at every solution under the sun. But when I say it's not just scholarships, we're looking at institutional lending offers. How do we raise capital to stand up our own revolving loan fund? We've engaged the HEC. We've engaged other community partners, saying, hey, we're looking around at the student loan market, and the best student lenders out there are state agencies. Largely because they have the full faith and credit of a very large state economy, Massachusetts, to a lesser extent, Iowa. States seem to be the emerging players here who can really help fill the loan gap, not the scholarship gap necessarily, but we are advocating for that as well. We'd rather see a lot more free money for students and get them out of their debt obligations if at all possible. But we really, really need to find systemic solutions, and not just for OHSU, but for all of our institutions of higher education. And that includes community colleges with nursing programs. That includes private schools that have optometry and ophthalmology programs. That includes, frankly, our social workers. I mean, they need support as well. So, when we start talking about, a systemic problem, it requires systemic solutions. OHSU cannot go it alone in finding a way to bridge this gap, because this is much bigger than our school. Well, my purview and my realm of responsibility is ensuring that our students have access to the funding that they need in order to complete. We know that this is much bigger than us, right? And the impact goes well beyond higher education and really touches every single aspect of life in Oregon. So, we're doing what we can. And again, when I say we are focused on this, we have 4 task forces currently under development to pursue all and any of our strategic goals. We're working closely with executive leadership to make sure that those goals are codified in our strategic plan. And we're talking about, when we talk about how much blood and treasure OHSU is putting at this, we're moving departments of hundreds of people to try to find a way to solidify that. That includes everything from student services to central finance to the folks who work in the departments doing just direct support for students. We really think that there's an opportunity here for the state to create incentivized structures to help keep students in the state after they graduate and not have to chase higher salaries because of more difficult and more expensive loan portfolios that they're going to have to take on because they have no other choice. Okay, next slide. Again, I think that there are some other ways to incentivize this, whether that's through tax breaks for students who are in medical professions. Perhaps they get some sort of incentive to stay in Oregon, and we can alleviate their tax burden. Perhaps there is an expansion of programs like SHOE or provider incentive programs. There certainly are other options in service areas, but I do think that if the state is going to, or other organizations really, maybe it's the county levels, I'm not sure, if they're going to get into the game and start providing some of the funding, that means they also get to shape the structure and repayment terms. So there is, I think, a way to both raise capital and create an incentive structure that not only educates the student in the state of Oregon, but then keeps them here for a duration of time so that we can actually build the firmament that we need for our long-term health and well-being as a community. Again, stipends for housing, healthcare, transportation. Much of what our students really struggle with is food insecurity and housing insecurity. Schools are very good at education. We're less good at housing, and we're less good at feeding. Schools are often asked to operate like small cities. For better or for worse, that's just sort of where we're at. But we could use some help, and we could use some expertise from people who really do work in the housing sector and really who do work in the food and the agricultural sectors. How do we create a synergy across multiple state agencies where it's not just the HEC and OSAC trying to fill in, what is really a big emerging problem both in hunger and homelessness. And then again, critical, how do we incentivize some of these lower paying, high need, positions like pediatrics or family care? How do we make those more attractive, both for Oregon graduates and for graduates who are from outside the state, to attract talent and maintain our intellectual bank of healthcare providers? Okay, next slide. That was a lot. I do want to thank you for your time and attention today. I know this is a grim conversation. Please know, I know this personally because I've had it probably 30 times now. And while I can see the room as a little tiny postage stamp on my monitor, I think that this is an incredibly sobering reality. I think, sharing this with as many people as possible, both in the healthcare space and particularly in the legislative space, I think is critical to create the partnerships that we're going to need to be able to address this problem. It is a problem, and we don't have any choices, right? So what are we going to do to fix it? And I think that the call to action is the thing that I would like to leave you with, right? It's easy to get despaired, but we have to find a way to do this for our students and for the larger Oregon community. If there are any questions, I'll hang out. Just throw them in the chat, and I will. I know we're way behind time, and I'll try to answer those questions while you move on to your next presentation.
Thank you, Eli.
We are, but let's ask one question for sure. Yes, let's do it. Or two.
Sorry. Very quickly, when do we expect to hear something on the lawsuit, and how do we track that?
Great question. There are actually 2 lawsuits right now. There are a lot of ways to do that. Google a legal, like any kind of legal space, will be tracking it. We got an update yesterday from our national organization, and again, I would tell you that the 2 leading groups that are tracking or that are filing these lawsuits kind of fall into one of 2 groups. So either you're in a state that's done it, or you're part of an association that's done it. So on the state level, Oregon is a participant in the state level legal battle. At the organizational level, AAMC, the National Nursing Association, the Physicians Association are all members of that lawsuit. They have asked, depending on which lawsuit you're talking about, they have asked for injunctions at before the July 1st implementation date, citing irreparable harm. That again is a scant 6 days away. This could all be this could all be upended in the next week. I would expect there'll be a lot of action prior to the July 1st deadline. I don't know what that will be. If I will say, and this is something that's very confusing, if they decide to offer or to approve an injunction, whether that's temporary or a full, based on new Supreme Court guidance, that will create a patchwork of incomplete implementation. If the state level lawsuit, their injunction is approved or issued, then only those 25 states in the lawsuit will be protected from the injunction or from the legal action by ED. So that will create a significant disparity very quickly between states that sued and states that didn't. So if you're on the the Idaho-Oregon border, you're going to have schools on the Oregon side that are going to be able to fund things under the old system, and you're going to have schools on the Idaho side that won't. At the association level, the issue is you're going to have piecemeal association approvals where those that sued will get the relief, whereas those that didn't won't. So you'll see probably all of this is to say that you might see an injunction and some action prior to July 1st. That will not be the end of the story based on whatever happens. Sean, I don't have the list of states in front of me, but I will tell you it's all of the blue states plus Tennessee and North Carolina the 22 blue states basically have formed the legal opposition to the current federal administration and are usually involved in most action in all legislative spaces, not just higher education. So that was a long answer to a good question.
Yeah, no, I just wanted to thank you so much for this really great presentation and mention about the provider incentive programs that were referenced because those are funded by the legislature and OHA manages those programs. And our largest incentive that we offer is loan repayment. We see tremendous demand for those loan repayment resources. We're only able to offer to the applicants, about 20% of those applicants actually get loan repayment awards. And that is very, very downstream. It doesn't even address like the earlier kind of pathway issues. So, they're going to be incredible equity impacts. I just wanted to kind of provide a little bit more context to that.
Thank you. Yeah, you're absolutely right. The need is massive, right? Yeah.
All right. Thank you. Thank you, Denise. Thank you. Max already jumped off, and Elijah, thank you so much for joining and sharing that. So for everybody online and for folks here, we are about 1 hour behind, but like we said, we'd rather be behind on something that is very important and worth your time. That's why you came here, rather than end on a nice note. But why did you come? So I'm happy that we did this. However, I know that we are due for a break. What I would encourage you all to do, you're not glued to your seat, so please stand up, maybe walk a little bit around. However, let's jump into the next one. We do have nice panelists joining us today. We have 3 folks online, and we have one in person, Simone, here. So we will jump right away into the panel discussion. So we've heard and we've discussed a little bit the policy changes right now and some other changes happening. Now I'm sure it would be nice to hear from those who are living these changes and experiencing them firsthand. Data is critical and important. Policy is critical and important, but nothing tells the story better than somebody who lives this life every day. And so the purpose of this panel is to not to just represent experiences, but it is really rather for the purposes of us understanding better the obstacles, the barriers, the consequences of all of this, and maybe there is a success story here. So as I quickly call you out, folks online, could you please come off the camera and introduce yourself, what you do, and which organization you belong with. Today we're exploring what student access barriers mean, and we have Christopher with us.
Hey, can you hear me okay?
Yes.
Great. Hey, I'm Christopher. I'm from Appalachia, Northeast Tennessee. I'm in the I'm in the ABSN, the Doctor of Nursing Practice program at OHSU in the Psychiatric Mental Health Nurse Practitioner track.
Thank you. Then we have Misty.
Good morning, everyone. Thanks for having me. My name is Misty Shoney, and I am the Community Partnership and Engagement Lead, and I work in the Office of Immigrant and Refugee Advancement. We are a statewide office. We are housed under ODHS, but we were created to serve all state agencies and cross agencies to help be a bridge and elevate between immigrant and refugee communities in Oregon to elevate their voices to other state leaders, policymakers, the legislature, and the governor's office.
Thank you. Then we have in our room with us today here, Simone.
Hello, everyone. I love having this mic. This is great. It's almost like karaoke. My name is Simone Campbell. I use she, her pronouns. I'm the Assistant Dean for Enrollment Management in the School of Public Health at OHSU PSU. It's a joint institution that's offering the School of Public Health degrees.
Thank you. And we have online joining us, Dr. Neufeld.
Hi, I'm Dorothy Neufeld. I'm the Director of Nursing at Klamath Community College, which is a very tiny community college. And when you were showing the map earlier on the bottom right where you had the giant red area, that's kind of where I am. We provide LPN RN program and soon to be RN to BSN program here. We also have outreach to Lake County, which is our neighboring county that is has a critical needs access hospital. And we provide nursing education through a on-site educator there for clinicals, and we have the students join us for a didactic here so that 90 miles away, individuals can train in their own community to become registered nurses to fill a need in that rural environment.
Thank you. So we will jump right into the first question, Christopher, and I will start with you. Little heads up, the questions will stay the same. The questions are prompted. Obviously, I wanted folks to think about their best experiences and for the purposes of time, what to share. But at the same time, I've changed them just a little bit. So it is really speaking from the heart and from the experience. So Christopher, can you share a momentum when you almost didn't continue your education?
Yeah. So a little short background. I know we don't have much time, so I'll gotta be careful because I'm from storytelling culture. We talk too much, and I have a master's of divinity, and I was a hospital chaplain, a mental health chaplain in the VA, and for a couple of years did a fellowship there. Then I worked in hospice as a hospice counselor through the pandemic era, serving in the rural areas in Northeast Willamette Valley, and I was always passionate about mental health, particularly when I got my master's of divinity. I've focused in the certificate program for gender and sexuality, with a focus in the ways that the gender binary affects mental health recovery, particularly toxic masculinity. And I could talk so much more. I'm going to skip ahead though. Basically, I came to this program because there wasn't a lot of opportunity in mental health chaplaincy, and I wanted to expand my skill set, include some of the biological side of mental health, so I could use my background in the psychosocial, spiritual, and the biology, and combine them to apply it to the work that I'm passionate about. And I was really excited. I couldn't believe I got in. But I came up with some financial challenges. So growing up, my mom was an alternative school teacher, a single mom, and my dad was not in the picture. I'm from the area where there's a high prevalence of opioid crisis, and my dad was struggled with addiction and just wasn't in the picture. And so I qualified for the Pell Grant when I got my undergraduate degree, and I had a soccer scholarship, and that's what helped me get by. So when I came to this program, though, I kind of ran into some financial issues because I had resigned from my job in order to go to school like everybody does. And I was single, and even though I had good credit, like 780 score, I was applying to all these different loans, and I was getting denied. And that's because I don't currently have income because I'm a student, right? And I don't have a cosigner because I can't ask my mom because mom doesn't have a good income, and so the only one I was eligible for was an 18% interest loan, and I had to take it because that's the only way I could start the program. So I did, and fortunately later on, I reached out to a distant relative, and they were willing to co-sign a loan. But by the time I got them to co-sign another loan, the current loan that I was on had already accrued in like 3 or 4 months. I was about $20,000, and it accrued up to almost $2,000. So if I had finished my entire program, that thing would have grown so much. And imagine how fast it would have accrued, especially if I had to take out more money each term with the same interest rate, right? And this is just the first year. Fortunately, I got somebody to help co-sign a loan, and I used that to help cover the cost of that one and to help me complete this first part of the program. But with all these federal changes that happened, anticipating starting the doctorate program was unimaginable. There's no way I could ask to take out that much money to continue this doctorate program. I wasn't going to ask a distant relative to co-sign that much more. That was so gracious that they were willing to do that. And I had to take out like a life insurance policy for them in order as part of our agreement. And so I was looking at not being able to continue, even though my passion and what I love, like what I'm fully committed to, has been to serve the underserved populations. I've worked with people in Tijuana, Mexico, who were deported. I've lived there for a whole summer. I worked in helping people who were transitioned from incarceration. That was what I was passionate about, helping people escape recidivism as well as houseless populations. And I've had a lot of incredible experiences, and I'm going to keep doing this work regardless of it. But I was, reaching this roadblock. And so I was feeling really discouraged, and I thought I was going to have to drop out. Now, fortunately, I am one of the really fortunate success stories where, as of this week, actually, I might tear up a little bit. I was granted the scholarship for a healthy the SHOI scholarship. And I'm going to get to do the program now. I mean, it's amazing. Like,
You're having a round of applause.
yeah. And I was in the service commitment's a no-brainer. Like, I was already going to be doing this work. I've already been doing this work. I'm already going to serve these populations. So, of course I'm going to do it. And so I'm really excited. It's not perfect. Like, there are the 100,000 aggregate limit, right? Like I already have $70,000 for my my master's degree. So I'm still going to have a gap that I'm going to have covered through some alternative loans, after my second year. But it's enough of a gap that I'm willing to take that, and hopefully I'll find a way for that. But still, it's just amazing. And I'm a talker. There's so much more I could share about my story. But I'm very grateful that I live in a state. I've been here since 2019 that has these kinds of programs. Because if I had gone, I got accepted also to the University of Tennessee and other places. If I had gone there, I wouldn't be able to continue those programs.
Thank you, Christopher. You're an amazing talker, and I wish we had a little bit more time, but like I said, folks can connect with each other afterwards. And thank you. You've covered even the second question. Thank you so much. One more thing for you, though. What would policymakers not understand unless they really walked in your shoes?
You're asking me again?
Yes,
what would
yes.
policymakers, can you repeat the question, please?
Yes, absolutely. What would policymakers not understand unless they walked in your shoes?
I think that there's a myth out there that people just want freebies, to get by through school. And what people don't understand is not just me, but there's so many loving, kind-hearted, compassionate people out there who want to help their neighbors, who want to do good work, and they can't because of finances. And if folks just understood that people aren't as bad as we've been told we are, like folks want to love people, they want to help people, but they just maybe need a little bit of a hand to help them help others, help people help others. And if we could figure out systemic ways of doing that, we can make it more equitable. And I do want to say one thing. It's really important to me to say this. 25% of my classmates are considering dropping out. I put a poll out there for my classmates, and including the only male person of color in my cohort, right? He's an amazing human being, but he's actually already officially dropped out. And so just shows the impact of how much it's going to affect diversity, equity, and inclusion, and that's just like that should be named.
Obviously 25% of what you're seeing from your perspective and from your classmates, this is only at 25%, but how many more students, right, are dropping out? So what Christopher is sharing, obviously we can see that this is just what so many students are facing right now. Thank you, Christopher. Misty, we'll transition to you right now. What patterns are you seeing among immigrant and refugee students and community, those who are pursuing healthcare careers, and what barriers most commonly prevent them from enrolling, persisting, and completing healthcare programs?
So it wouldn't be, it may not be specific to only healthcare, but it does impact, the pathways for all of the workforce right now. The biggest thing, as our office has been connecting across the state, is immigrants and refugees are experiencing tremendous fear and uncertainty due to federal changes changing almost daily, and the changes related to HR1. They're experiencing the loss of access to food security, increased immigration document fees, immigration legal costs, some losing employment authorization and losing employment, and family separation due to ICE. And in many of those scenarios, their primary wage earners in their home or their only wage earners in their homes of their families are being detained. People are afraid to access basic services such as send kids to school and access healthcare due to fear. They're having to prioritize trying to secure their basic needs for their families. We've heard of some young adults that have taken on additional jobs to help support their families right now. I heard a story just this week of someone that's had to stop attending GED classes because they need more hours to work to help their family pay for their immigration legal costs. Specifically, in healthcare, we continue to hear about recredentialing. Recredentialing is extremely difficult and challenging. We have many refugees and immigrants who worked in professional careers such as doctors, nurses, lawyers, engineers in their home countries, and those credentials are not recognized in the US. It's very complicated to navigate and can take many years if they're even able to do it. I've personally, over the years, met more than a few individuals who were doctors for many years in their home countries, and right now working in a field that's not even directly related to healthcare. I think barriers, there's a lot of different barriers, but one piece I don't think that everyone always thinks about is the systems that immigrants and refugees have to learn when they arrive in the US. Navigating complicated systems, such as understanding the US school system, tasks like enrollment, financial aid, scholarships, eligibility, credentials, grading systems, credits, they're not the same in other countries. We've heard about families or children, even US citizen children, experiencing fear to even apply for financial aid, and because they don't want to put their family's information on the application because they're afraid they're going to put their family members at risk. Language access. Many immigrants and refugees may not speak English when they arrive, and they have to learn English very quickly, and that takes time. And then now, while experiencing fear, trying to understand the systems, the cultures, and immediately have to provide for their families. Many don't have digital literacy to even be able to navigate on the computer, and all of the systems all require you to enroll on the computer. So many students are first generation college students, and they don't have the family support to help guide them through. Parents do not know what's available and how to support their children to enter these pathways. We hear all the time that even kids that are in, high school, they're trying to navigate, trying to figure out college, but their parents don't understand the systems or supports that they're out there to even be able to help them through that and help support them. The list goes on. I don't want to take up too much time.
Thank you. And one more question. What strengths do immigrant and refugee communities bring to Oregon's, workforce, healthcare workforce, that we should be paying more attention to?
So I've worked directly in the immigrant and refugee space now for over 10 years. And what I've seen is most immigrant and refugee families come to the US, they're seeking safety and they're seeking a better life for their families. They want to go to work. They want to be educated. They want their kids to be educated, and they want to be able to provide for their families. They are so brave and so resilient. Many have healthcare experience. I think about it, if we can try to focus on learning what the challenges are to getting into the workforce for the different communities and then identify solutions, I think that would open up way more opportunities and pathways for them to enter the workforce.
Thank you. I think we're hearing very common themes between Christopher and Misty here, that system navigation, those kind of barriers, right, affordability and support systems. So speaking about support systems, Simon, next question is for you. What trends are you seeing among students related to affordability and access, and what concerns do you have about maintaining that kind of workforce pipeline if these barriers continue?
Absolutely. So many people have already highlighted some of the concerns that we're having and the trends that we're seeing, and the impacts that we don't even know to anticipate yet because of the new changes. So already, before students even understand the new impacts to financial aid, we're seeing that 25% of graduate students are expecting to be able to have any kind of income from themselves to go toward education, only 25%. So well over half of students are expecting to have those gaps filled in by scholarships or work study or stipends, and that's only going to increase. And that students are picking their disciplines, their institutions, their careers, not just based on, as Christopher said, a call to action, a love, a desire, an interest, a skill set, but really what is going to happen after the fact, what return on interest is going to have for me. And so they are not, some students are not even willing to even think about disciplines or institutions depending on the price tag, right? So you're seeing students, a recent study that showed about 60% of students are not willing to pay more than, or not able to pay more than $20,000 per year, which is only going to be heightened with the new rules. I think we are also seeing that students are deciding to, they're needing to make really heartbreaking choices. You know, what does it mean for me to have to take care of my family, my parents, my children, or think about this investment in my career and my livelihood in the future? Can I do that right now? And how can these institutions, how can these spaces, how can these programs help me do that? And ultimately, I think there is a concern about, you know, folks being able to fill in those workforce shortages. So not being, we understand that we're all connected, you know, every single institution, space, we're all connected in the overall health of our state. And each of these areas have an impact on whether or not we can be a healthy Oregon, you know? So I'm concerned. I mean, I know the rest of this room is very concerned. Students are concerned. And we don't quite know how we're going to be able to address the bigger gaps that will be coming after July. But it will take, you know, a combination of both upstream and downstream tactics. We're seeing that students, once they're in our programs, we need the flexibility of being able to support them, and some of our dollars in ways that we, you know, Denise started out with saying, our students need money. Yes, they absolutely need money, but we need flexible dollars as well, not just for tuition, not just for fees, but, you know, that persistence in the, if there's a big rupture that happens while they're in their programs, that's one, you know, unpaid bill, one car, you know, malfunction, one sick child away from dropping out. And we don't have flexible resources to support students while they're in their programs to help them navigate those things. So it will take a lot of different strategies and partnerships to really make sure that students are getting their needs met.
Thank you. Thank you, Simone. I think that those statewide, you know, trends often show up, especially so and foremost and most acutely in the frontier or rural communities. So Dr. Neufeld, my next question is for you. From your perspective at Klamath Community College, what are the biggest barriers preventing rural students from entering and completing healthcare programs today?
I would say the biggest thing that I see is financial, and the fact that many of my students work, and we usually encourage them not to work full-time while they're in school. But guess what? A number of them, that is indeed what they have to do, because they've got to pay the bills. And you can always tell, I've been teaching in Florida before I moved here 2.5 years ago. So I've been teaching since 2014. Most of the time when I start to see academic decline, it has nothing to do with the person's intellect or the capacity to learn. It's to do with stuff going at home, right? It might be personal stuff. It might be I'm sleeping in my car. My phone got turned off. I have no internet, all those things. Or they're coming to school exhausted because they've had to put so many hours in. And I just kind of think of the point of privilege that I came from, because when I was a kid growing up in Canada, and yes, I am an immigrant, so I can attest to what Misty said, immigration is not as easy peasy as most people think. And for me, it was extremely difficult. And I still live in fear this day with a lot of the rhetoric that's going on, that maybe if I accidentally put a box wrong, somebody could come for me. And that's my reality. But for our students, I think just, I've had them tell me, like, not being able to have gas, like, that's a big issue. And even when you think about it, when I mentioned the group at Lakeview, we do try to have them come down occasionally to Klamath. But right now with the gas prices, 90 miles there one way and 90 miles back, that's a big deal. The things we're trying to do to make things better here is that as a community college, we have different entry points into healthcare. We have a medical assistant program, we have a CNA program, we have an LPN program, we have an RN program. And starting this fall with a consortium of other community colleges, we will have an RN to BSN program that's totally online. So one thing we can do to kind of combat financial stress for potential students is looking at layering careers or doing a pathway. So I talk to students a lot about, well, get your CNA first, work in healthcare, start to decide if this is really truly what your passion is, because that's a great way to learn. But at the same time, as you're working in healthcare, you're gaining experience is going to help you academically as you progress in school. But also you have the ability to access tuition reimbursement from an employer. Come to us then, get your LPN, have a pay increase, go work as an LPN for a year or so, save extra money. You've got again, a livable wage for here in Klamath. And you're again gaining experience and expertise in healthcare that are going to help you. A couple of years later, apply to come back to finish that second year to do the RN, LPN to RN transition. Then at that point, if you want to do your BSN, you can do your BSN, again, access tuition reimbursement, and do that while you're working full-time as an RN. So one of the approaches we're doing too is even reaching out to the high school kids and trying to encourage them to do the dual enrollment so that they potentially could come straight out of high school into nursing and not have to have that financial insecurity, because it's tough. And like Christopher said, you want to see a diverse population. You want to give people opportunities. And so how can we, do that? And I think doing that layering, like little piece, little piece, little piece, little piece, can be a way to get to the end. I have a picture in my office of a friend of mine that I used to work with in Florida, and she graduated from Florida State with her doctorate in nursing practice this past May. She and I worked together when she was an LPN and I was a diploma RN. Long story short, I ended up becoming one of her teachers because life happened, and she and it took years before she got to go back to school. I got my master's and was able to teach. She never gave this up. So, we took chemistry together when she was planning on going back to nursing school back in 2006. This is now 2026, and she's now doctor. She did it in little bits and pieces. And I have her picture in my office. And when I have students come in here, I'm like, you don't have to, if you can go to a 4-year school and you can get finance and you have family support or whatever that can take you there, that's great. But there is nothing wrong with doing it little bitty, itty bitty progress route, because that's going to get you where you need to go in the end. It doesn't have to be a race. And every little step you make on that way, it's building your career. It's giving you knowledge. It's giving you opportunities. It's going to really enhance your education. And I look at things like professional associations. My background is in emergency medicine, so I was a member of Emergency Nurses Association for years. They have student memberships. They have scholarships for individuals in nursing school. So as an educator, I've been starting to look out like, what other things can I tap that I can suggest to my students that might access them funds in places they may not think to look, because they might not think that they belong in a professional association already. But number one, it's going to give them some great educational opportunities, looks good on a resume. If you can get into the meetings with the professional groups in your area, networking happens. But also it lets you have a chance to maybe access some resources that you might not think of. So that's kind of where I'm at. I hope I answered that question for you correctly there. Thank you.
Yes, you did. You kind of started answering the next question, maybe a little bit more. When students are unable to enroll or complete healthcare programs, what does that mean for healthcare employers and communities, specifically for rural Oregon?
Well, we just basically have needs that are not being filled. I mean, literally not being filled. In our area, both the hospitals, like the Lake District and here in Klamath at Sky Lakes, are always looking for nurses. Particularly right now in Klamath Falls, we have a shortage of LPNs. That is a huge thing. So it really, if we can't get people into the education system, we're not going to have our needs met. I'm a 63-year-old woman who has to go to the doctor from time to time, right? I've got skin in this game, because if I can't support students, there's going to be nobody there for me when I'm sick. And that I have to kind of like preach to everybody I talk to. Like, I have a really supportive president of our college, Dr. Gutierrez. And I have talked to him about how the LPN shortage at our local nursing home then impacts the hospital, which then impacts the ER and bed availability, so that when you go to the ER and you can't get seen quickly because the beds are full, it's actually back to a lack of staff in the nursing home problem, because all these things connect. And not everybody sees those systemic connections as to, well, why am I, and we know that ER holding patients is not evidence-based practice has told us that is not best care for patients. But it's not an ER problem, it's a systemic problem. And it's not just a hospital problem, it's a community problem. And I think that's a really hard concept to sometimes, you ask Christopher, like, what things politicians might not get. That's a thing. Like understanding the connectedness of systems and how not helping me educate to get LPNs in our community impacts tremendously beyond what some people might think it would. And that, I think for all of us that are here today, getting that message out that we're more connected than you think. And, it's back to that, when the butterfly flaps its wings, the whole world feels it. That's true. And getting that word out and thinking about, like, what are the true consequences of these actions. So yeah, I mean, our whole community suffers when I can't get students in here. And that's really sad.
Thank you, Dr. Neufeld. I'm going to ask one more question, but of all of you. If employers, so today we have everybody in this room and online. So if employers, educators, workforce boards, healthcare organizations, and state organizations, and our partners, not could, but I should say must take one action in the next, whatever it is, 6 to 12 months, or maybe right after this meeting, bring this back to their teams to improve student access and strengthen Oregon's healthcare workforce pipeline. What must it be? Misty, Christopher, Dr. Neufeld, Simone, anybody can jump in?
I can go.
Thank you, Misty.
I was trying to think of something that would not be, it would be financially as neutral as possible, right? And I think right now, communities, at least in immigrant and refugee communities, are going to their trusted partners in the community. They're going to them for information. They're going to them for help. So one thing could be to reach out to your local resettlement partner. It could be reach out to community organization, culturally based organization. Build a trusted relationship with those partners. Those partners right now are walking alongside people, helping them to enroll in English classes, to help them find work, and helping them enroll in school, and providing those wraparound supports and that trusted relationship. And so if you build a relationship with those organizations, their staff are the ones that are helping people to maneuver through these complicated systems. And they have to understand the system. And they're also able to provide you with strategies that may be able to help the access there. So, and I'm going to put it out there that I'll put my contact in the chat. If you're like, hey, what's an organization in my area that I'm not connected with? We have a lot of partners across the state, and I'd be more than happy to connect you. Or do an introduction for a lot of these community-based organizations.
So from my perspective, I want to be hesitant to encourage individual organizations just to see a solution as having incentivized reasons for clinicians to work for them, because the result of that, what we saw during the pandemic, was I was working for Willamette Valley Hospice, and we had a massive nursing shortage. And some of the for-profit hospices, we were a nonprofit, and some of the for-profit hospices took advantage of the situation, and they had sign-on bonuses that our hospice could not compete with, right? And so it created, nurses, even if they morally or ethically didn't feel like they wanted to go in that direction, might take that just because they had to. And so as far as individual organizations, I'm skeptical to say incentivize, paying off loans and that kind of thing, because it could also contribute to unintended consequences. So what I would say to do is we need to build fusion coalitions amongst multiple organizations parts. The more bridges we build, that can help, create the kind of power that we need in order to promote better legislation that's sustainable. And then not just change the legislation, but we have to remember that the voter base is what actually sustains legislation, because you can create a legislation and that can be changed depending on the voting outcomes. And historically, the medical environment has been a very apolitical environment, which is a good thing, because we need to love people and support them regardless of their background. But we do need creative and gentle ways to help educate the public on the impacts of our elected officials. And I don't know how we could do that, but we do need that in order to sustain anything that we do.
I agree. I would say on the very basic level, take what you learned today. I know many people had some aha moments and some shock moments of how this is directly going to impact the spaces that you have access to, and think about how, again, to strengthen us through coalition, through legislation, but also you're already connected and you're already partnering in many different ways. I know for public health, we have a lot of internships and partnerships with organizations already. So what are the ways that we can strengthen our connections and expand outside of the box? So we're going to have to do a lot of creative thinking like we did during COVID, I think, in these next kinds of stages. So yeah, I would just echo what Christopher said, but add those two thoughts.
For me, I think one of the takeaways that I have is use your voice wherever your voice could be heard. Speak to what we've learned today, so that maybe people understand more about the impacts of policies that maybe they haven't really thought totally through. So, and that takes bravery, and that's hard sometimes. So that would be one thing I would say we need to do, is just not be afraid to talk about these difficult things. The other thing too is also think about being creative with our delivery systems. I have talked about potentially doing like a evening weekend LPN program or an evening weekend part-time LPN program, something that might help somebody who has to stay in that job where they have to work Monday to Friday, but they still want to go to school. So is there a way to re-envision some of the programs that we currently offer in a different format that might be a little easier for people who are in those financial situations to be able to access academics? Because, and the reason I always speak about this with the LPN program is if I can get you to become an LPN, I have increased your income potential. I'm filling a need that is desperately needed in our community. And if you wish to stay there, that's great. But if you want to go on and do something else and go back and get your RN, that pathway now will exist. And it's probably going to be easier for you to financially access higher ed because I've been able to help you get a degree that's going to boost your income potential. So instead of having to work as a CNA with this salary, if you and have to do X number of hours a week, if I can get you to get that LPN, then maybe you, because the income's higher, you can back off on the hours you have to work and then get that RN and slowly make progression. So that's another thought.
All right. Thank you for sharing that. There is so much more. I have so many more transitions and questions we have, but at the same time, this is obviously not the end of this conversation. Thank you for joining us today. Simon, Misty, Dr. Neufeld, and Christopher. And also, Christopher, I know that your family is visiting, so you took time off to really join us today for the conversation. Thank you. Hi to your family. Thank you. So looking at our agenda and also looking at our time. Oh, yeah. We can do that. We have applause in the room. Thank you. Looking at our time and looking at our agenda, and also we didn't really have a break. So what do you all think if we jump right now for 5 minutes with Kyle Thomas joining us right now, because he's also a super book today, but he will join us and share a little bit, maybe good, well, semi-good news or some things that, because Oregon doesn't start from ground zero, right? We have something going on, already developing strategies to support students and strengthen workforce pathways. But at the same time, he has a message that he could share with us. And then we will have a short break, grab lunch, and we will have a working lunch over the discussion groups. So, Kyle, we're ready.
Yeah, this is the first time I'm seeing this slide deck, so I'm a little confused by its presentation on
This is just a welcome. There is no presentation. It's more of a welcome, your
Thank
introduction.
you.
So
All right. I got real nervous real fast.
We can take it down.
Okay. No, it's fine. Thank you so much. For the folks that I don't know, my name is Kyle, or you don't, who don't know me, my name is Kyle Thomas, Director of Legislative and Policy Affairs. I'll give you 3 really quick updates, and I can do this in about 5 minutes. The first is that there has been movement on both on the federal level when it comes to the issue of graduate student eligibility, in particular healthcare and nursing student eligibility for graduate student loans. It's a very small movement, but any movement is positive. And that is that the House appropriators that have cognizance over the Department of Education budget have included in their budget proposal a bipartisan amendment that passed 38-24 that would reestablish nursing programs as professional degrees for the purpose of graduate student loans. That amendment, though bipartisan, was included in a broader bill that was partisan. This is one step in a multi-step process. The Senate has not yet released its version of a federal budget that covers the Department of Education. I think it's probably likely that the Senate will include this amendment language in their version of the budget, but we have many, many, many more steps to go before the federal government actually would take concrete action to restore nursing programs as professional degrees. On the state level, there continue to be some folks that are looking into this issue. I think the last time I talked to you, I said that there was a group that was looking at the possibility of establishing a student loan portfolio within Oregon. This is something that at least 2 states now have done that have had existing loan portfolios. They've adapted those portfolios to include graduate professional programs that were excluded because of the federal government action. So that's happened in 2 states. The group that met in Oregon, I think, really has determined that it is not feasible in this budgetary environment to move forward in that specific direction. However, I am aware that some folks are now looking at the possibility of establishing some sort of tax credit options that would aid affordability for students in nursing programs. Those conversations, I think, are very preliminary. I will be clear that I am not directly involved in those conversations because they're tax policy conversations that typically have a lot of import outside of HEC as an agency. We have offered our assistance in doing calculations and being supportive wherever we can. But we're not an agency that drives tax policy. Those conversations are going through Representative Nancy Nathanson, who's the relevant chair of the committee of the state legislature that deals with tax issues. So if there's a desire for more information there, I can certainly do some work to connect perhaps some folks in this consortium with Representative Nathanson's office. I'm happy to make those connections. But just know that HEC is not sort of at the table directly in these conversations. Nonetheless, another sign of some positive movement. The last thing I will update you all on is that I think I said last time that the major piece of legislation that the state legislature adopted this year was House Bill 4124, which requires this all-encompassing study of the future of the higher education system in Oregon. That work is about to really kick off in earnest. We have established a leadership committee that will serve as an advisory body to drive some of this work forward. We've established a number of other tables for folks to sit at. One thing that we're hearing very early on as we start to think about how the work of this study gets done is the concern that historically here in Oregon, there has not been a significant plan-oriented set of strategies that directly connect workforce and economic development to higher education policy and funding. That's not a surprise to us at HEC. There really isn't a broad statewide economic development plan that includes higher education as a key component of that plan, but we are hearing that is a significant concern to individuals. And so it is possible through this process that the study could include some recommendations that much more directly tie workforce and economic development to higher education, all the while taking steps to redevelop the higher education system. I would say stay tuned on this. It's really sort of, because we're in the very initial stages of this, the contractor has not even gotten their boots on the ground yet. There's a sort of a lot of open questions here. I can stop right there. And if anyone has questions, I'm happy to answer them, or else you can go on your well-deserved break.
I don't have a question, but I just wanted to add regarding tax credits. There is existing tax credits that are offered. There's a rural medical practitioner tax credit that the legislature has in place, and an EMS tax credit already that are administered by the Oregon Office of Rural Health at OHSU. And for the rural medical practitioner tax credit, it's in statute that OHA includes it in a biennial report. So that I just wanted to provide that context. There is already some existing tax credit structure here within Oregon.
All right, thank you, Kyle. I don't think there are any more questions, but again, I know that we can connect with you later if needed, or folks let me know and I will find those answers from Kyle. Thank you. Thank you, Kyle. So now we have a working group discussion, but also we have let's have an opportunity for the working lunch. We'll call it a working lunch. Eating and talking will be absolutely yes, please, during this time. So let's have maybe 5 minutes to grab lunches. Lunches are there, and also use restroom. And then let's do this way. For the folks online, you will have one group. Robin will be leading and Heather taking notes. We will have 15 minutes we will reduce a little bit the time here. We'll have 15 minutes for small group discussions, and then we will come back and we'll have 10 minutes for reporting out. We will have 2 groups here in person. Let's do this way, maybe 1, 2, 1, 2. Remember your number, and then this will be your group number 1 and group number 2. Let's start, Milan, with you. Grab, okay, 1 and 2. Okay, perfect. So let's do group number 1. If group number 1 could please be with Shauna and Shonda, and then group number 2 will be with Jennifer and Danielle. Lunches are over there. Please grab your lunch, and we can have maybe, if we want to, one group maybe somehow sit closer together here, and then the second group will be over there. How about that? Works? Okay, yeah, let's grab lunches, and then, yeah. For the folks online, we are grabbing lunch for 5 minutes, and then we'll sit down and we'll start working for 15 minutes. Group discussion, 10 minutes, report out, and then I will call you back here. Thank you.
Okay. Online folks, it looks like people are starting to gather in their groups. And so I want to invite our little unit online, if you are there, to maybe turn on your camera and we'll know that we're ready to roll. Hey, Ronan, were you going to
Hey,
add something?
Robin. Yeah, I'm gonna open the breakout room so you can all go in there because I think they can
Thanks.
hear us in the
Probably.
space right now. Yeah.
Thank you.
Yeah.
We made it, Sarah.
You got the notes?
Time to like, nice job.
Perfect. That's exactly.
That was quick here.
Share the infrastructure.
Yeah, sure.
For the folks online, we are coming back. Let's give it one more minute and then we will start with report out. We will start with one group here in the room. Then we will switch to online since there is only one group, and then we'll come back to the in-person group.
My cookie.
Jen, you have the reporter from your group?
Yes.
All right, we will start with you then, okay? With your group first to report out. Is that?
We did not select somebody to report out, just FYI.
Okay.
Maybe somebody will be kind enough to volunteer. Go guys.
To my calls. Right. Okay, maybe if
I'm putting them to just one, I need 1 minute. Yeah, we.
all right, so let's get started then with group here. And who's reporting out here?
I volunteer our Clackamas Community College person who is very active in our organization. Hey, you know what? No volunteers and people get volunteers.
I like the gosh no, that typically is coming as a good report. Thank you.
Let me see if I can remember. And everybody and anybody that was a number 2 in the group can participate in this. But there was a lot of do you want me to go through the questions or do you want me just to give a summarize? Okay. Some of it was discussed, and I think some of the bigger, more important pieces were kind of that collaboration when it comes to making sure that we have all of the key people in the room, like bringing more people into the room, right, and the table when it comes to all the education partners as well as employers. And when we say education partners, we're not just talking about certain groups, we're talking about all the groups, and that includes K through 12, to make sure that there's more of an alignment with what the schools are doing, getting early exposure, but also support and inspiration for them to continue with their education all the way through. When it comes to healthcare, we talked about how challenging it is to not have a statewide kind of system in place, I guess, for education, which is hard to kind of coordinate different activities. Similar, like Washington has a statewide approach to economic development, training, and their education piece. And I know that Kyle mentioned something about that conversation starting. What else did we talk about? We talked about primary care being a really big, is going to have a huge impact. I mean, it's already had a major impact since COVID. We've had years of challenges with the primary care piece and meeting that, not just in rural areas, but primary care, preventative medicine, the CCOs, all the payment, everything, all the metrics were for prevention. And so when we have a major issue like COVID, when we had to shut down doors in different ways to see patients for prevention, we had a huge loss, not just the hospitals, clinics, but and primary care doesn't pay as much, right, as part of that. So trying to get people going into primary care, EMS is a challenge too. EMS, EMTs, making sure we have enough of them and more of them because there's such a high turnover. Also, they volunteer at fire departments. And so it's really hard to track employment when you finish a program for an EMT because sometimes they finish and they go to volunteer. So when you talk about metrics at the state to report completers and graduate and employment, it makes it a little bit hard when it comes to EMTs. Did I miss? What else we talked about a lot of stuff. Yeah.
That's good.
Oh yeah. Building on existing infrastructure that does work when it comes to loan. Tell me more.
Incentives.
Provider incentives, scholarships, loans.
And kind of assessing which of those solutions is most effective or most impactful, and seeing, where do we get the best return on investment with those programs, and then building on that, rather than trying to reinvent the wheel, building on existing structures that are already in place.
Yes.
And we also talked about, I call them no fuss scholarships.
Yes, the no barrier, low barrier scholarships.
Where students don't have to apply, there's no eligibility criteria, everyone gets one, it's simple to administer, it's simple for the students, it's simple to administer for the institution, to help students open the doors for students.
I'm noticing that we are transcribing, so that's working without the microphone probably, huh? All right, well, thank you. So this is group number 1. Thank you very much. Let's jump into the online folks right now. We have one group there. Robin and Heather, who could report out.
Hey, it's Maria, and I will do the reporting for my group. So I'll go ahead and give a summary of what we discussed, and I won't go in any specific order for the questions, but we did address them. So we are most concerned about losing master level clinicians, especially in psychiatry. Anything advanced practice like nurse practitioners, PAs, anything of that level concerns us because of the current changes coming ahead. As far as how this can affect us, behavioral health overall, the reduction in programs, both because of the cut in Medicaid. As I've learned, there's a higher payout from Medicaid versus from private commercial insurance. So being that Medicaid is most at risk right now for the decline of payment coming forward, that's going to affect both the clinical setting and the patient themselves, because now we'll have less people to provide the service. And let me see, okay. Going forward, what can we do as far as recommendations as a consortia? To focus on apprenticeship programs, like perhaps CTE programs that can help at low cost or no cost. Provide more support to employers in form of incentives. Try to sustain the state level support that we are receiving, and encourage licensing boards to also be a little bit more incentivizing to those that are trying to get into the profession. And that's what we have as a group.
All right, thank you, Maria. Thank you for the folks online participating in this group. And now we have our last group here in person. Rob.
So we talked about many similar things. We have great notes, and I got an AI summary, so that was very helpful. One of the things that in this, I don't think we use this phrase, but the AI kind of picked it up, is that we may have an infrastructure crisis. Very quickly. I mean, actually, I think it's already happening. I know it's happening on our campus in terms of some of our licensure programs at Western Oregon University. The students are already looking at potentially stopping out. The students that are wanting to start are having second opinions. We're trying to get them in before July 1, like OHSU. So immediately we're going to have an infrastructure crisis. It takes many years to ramp up a program like this. And if we lose that capacity, the universities need to respond. And within a year or two of having decreased enrollment, they have to reduce the number of faculty so other programs don't close at the university and the university doesn't get in a very difficult position. So I think that's the infrastructure crisis is huge. And then obviously, I mean, this has already been said, but I just don't think we can underestimate the impact on access and diversity, equity, and inclusion. And I think it breaks many of our hearts who have been here. We worked really hard on Future Ready Oregon to try to increase the diversity of the pipeline. And I'm just kind of watching a lot of that work just unravel before our eyes. So that's disheartening, and that will clearly be an impact. So The other thing that needs to be talked about too is just this was already complex. In the behavioral health talent assessment, for example, the complexity of the licensure programs and the credentialing programs we have in Oregon was highlighted as a barrier. Now we're going to add in the tripart financial aid repayment system, so that complexity is going to be really challenging. I don't think our group had much different in terms of the area's impact. I think that was fairly well covered. I think we are worried about primary care, behavioral health, rural and nursing, and social work. Then, some of the things that employers can potentially do. So I'm hearing a little bit of a theme here. And I think I'm glad we're ending on this because there's a really a unique opportunity for increased partnerships between the healthcare sector and higher ed. And I've often been surprised that hasn't happened more. It's easy to do. There's a federal tax credit of $5,250 that the employers get when they pay for educational expenses for their employees. And I think there's some opportunities there in addition to some self-serving philanthropic work. I think we're going to need to be looking more to the private sector to move forward, and the motivation to develop these partnerships certainly has never been greater. It was also mentioned that grant writing and our workforce boards could be working with all of us moving forward as the experts in that area.
All right. Okay, perfect. That summarizes it. Thank you very much, everybody online and in person. So what we're doing next, what I'm doing next with all of this is I am going to look through all the notes, collect this feedback. And as you can see, feedback is implemented within the quarter and into the next meeting or in the work in between quarters. So thank you very much. And if there's anything you would like to add at any point of time, my email, please reach out to me. I'm really, really welcome connecting with you. So next, we are jumping into the whole group discussion. I've reduced it to 10 minutes. We have only 3 questions. They're pretty big though and broad, but this is participation from all of us, from all of you here in person and online. And why? Because diversity of perspectives is really what this consortium brings together. We're all very different, all different areas in healthcare. So the first question, and that's really, I want you to talk, I want you to respond. We will alternate between folks in the room and online, so that everybody has an opportunity to participate. So what can this group advance within the next 6 months, and to whom? And what needs to be prioritized? Let's start with the folks in the room.
I think we all should be very astute to what's happening with House Bill 4124. Took legislation to get this passed. It's underway right now. Higher Education Coordinating Commission is the conduit for that. Pay attention to opportunities to raise our voice and influence the outcome of that study, because I think that will have far-reaching implications for the environment and the structures in which higher education runs, as well as the interface with workforce development and so forth. So now is the time. It is within the next 6 months. So don't lose track of that bill.
Can you state the bill number again?
House Bill 4124. Kyle mentioned it. And if you go on to the Higher Education Coordinating Commission's website, I know it was an update. I think it was just launched today. I was looking at it as I was coming here.
Yeah, perfect. Yeah, there is an update there. Yes. Anybody online? The same first question still? Denise?
Thank you. I don't know if this is all possible within the next 6 months, but I think kind of consolidating what the themes that have come up in our conversations, I would say continuing to strengthen the workforce partnerships that we have, building and expanding upon the high impact infrastructure like the provider incentive programs, workforce pathway programs, incumbent worker training, identifying the high impact activities, and then building and expanding on those, and then scholarships for students. Students need money, and the more we can provide, and there's structures that you can put in place to ensure those scholarship dollars are put to good use.
Perfect. Thank you. Again, folks online, if anybody has anything to add, please, you're welcome to jump in at any time.
These are also really good ideas. I absolutely agree that I think this group could help inform talks on House Bill 4124, because we have a lot of good information about where the needs are and quick access to some of the potential partners. I think that was a really insightful. I hadn't thought of that. But I think I just want to expand upon the idea for the scholarships. I mean, in terms of, if maybe I'm jumping ahead, but policy recommendations, it has to be thrown out there that, I know we're not a lobbying organization, but it would serve the state if we had something like the Oregon Opportunity Grant for healthcare, for people. It's a need-based program, because we need to combat, many families are going to be able to fund this for their students. And I think that there will be a lot of families wanting to go into healthcare. It feels more AI proof, which a lot of the conversations families are having about the impact of AI on job prospects for the next 30 years. And a lot of families are going to fund this, but the families that have the need, they're the ones that aren't going to be in the system in the future if we don't act. And I think some legislation to create, an Oregon Opportunity Grant for healthcare would go a long way to working to mitigating the DEI impacts of the federal legislation.
Yeah, very good. We jumped into the second question, which is perfect timing. Anybody else to add anything here or online to the second question? Partnerships, policy recommendations, funding opportunities that this consortium could lead.
Going backwards, I was just looking at the summary of 4124, and I guess I'm still concerned that this is very broad, but it's too narrow for what we're talking about. And until we look across the state at all programs in healthcare that are private and public, to knit all those together, or at least attempt, I understand privates is a hard piece. I don't know how we don't end up where we are right now with, all the duplication and the questions and trying to start things without knowing what everybody else is doing. Sorry.
No, reality good. Ronan, I might not be seeing any maybe questions in the chat or online. Just in case, let us know. All right, well, perfect. Let's jump into the third question then. Now, what opportunities are there to inform other work going on across the state, and where are there existing resources, partnerships, and also the momentum? So we don't create something, you don't start somewhere else, but actually build on something that's happening already. Been exhausting already. I feel the energy. I get it.
Is it okay, Daria, if I offer something?
Absolutely do. Yeah.
One of the things that I have experienced often, and especially in this meeting today, is how many amazing things that are coming out of OHA and the different resources and opportunities. And I wonder if there's more ways that the consortium can partner with some of the things that are already happening with OHA to help build that stuff up. And maybe that doesn't make sense, but that's one of the things where I hear about things that are already happening that are good. And is there a way to make that even better? So I would just offer that up.
It does make sense. Thank you, Robin. And that's partially why OHA team and focus team and OHA in general is involved so much today, because that's exactly that alignment that we were talking about, creating that kind of partnership where we don't do something similar somewhere aside, but rather than duplicating the work, we're coming as a strong team together, as stronger voices together can advance the work rather than all individually, not one single organization. But yes, perfect comment. Thank you very much. Yes. And Sheila.
I'll have two. One is just an add-on. I think Rob said this earlier. So to answer this question, how will the voices of this group be used to, and the work that this group has done over the last year, 2 years in its existence, how will all that work and that knowledge be shared with the Higher Education Coordinating Commission in their study for 4124? I mean, why duplicate it? I know there are a whole bunch of committees that are being populated, but this group has a magnitude of information and experience that have already existed. I wonder how it can be packaged up and shared with that group and that work. So it just adds to it. The second, I would say, is what's going on with the workforce development and the regionals. There's so much going on there already. How can we continue to magnify that and spread that across the different regions? Career technical education, I heard that earlier today. In several of the regions, they're being really successful. In my region, they're not. They're really experiencing some gaps. And so how can we magnify where the successes are and then share those in some of our other regions?
I know that somebody posted a similar question even earlier in the chat, that last one. And so we will be going through that as well to actually think and implement and respond. But
Ask a question, and so this is my first time attending this, since I'm just curious, is there a resource hub? Is there a some sort of platform or resource hub for people to put in what they're doing? Like, how is information shared across the state with different education programs? I know Rogue is doing some amazing things too. Like, how is that collectively being put somewhere as a repository for access of what is working and what's going on? Or is there a place for that? Does something exist for, do you know what I'm talking about? Sorry.
not necessarily maybe a resource hub. Well, I can speak to my experience so far, right? In only 8 months but this consortium, we're very well connected. We are very connected throughout the meetings as well. Constant feedback loop. I know what's happening. We know with what's happening with each other's fields. So this is kind of like quote unquote resource hub this way. So far, there is no official resource hub per se. I know, I see Robin jumped in right away.
Yeah.
Yes, because that's what I wanted to refer, but there will be one happening with the behavioral health. So with the overall healthcare sector in general is a healthcare consortium. We are per se so-called the resource hub, and anything that's happening, we're staying connected. So this is what I would reinforce at the moment right now. But in terms of the resource hub specifically, Robin.
Yeah, no, I appreciate that answer, Daria, because that's absolutely true. Like, this group is an amazing sort of container for everything that's happening in the ways for people to connect and share that. In addition, one of the things that we're working on is starting with a behavioral health resource hub, where we would pull all things together, including like template for starting a CTE program to different pathways into behavioral health. And my hope is that that resource hub will be sort of just phase one of creating a resource hub for all the different industries, including healthcare more broadly. That's the behavioral health phase of that is in the works, and hopefully we will have something that is up and running in about a year. But the hard part of this stuff is it takes time. And so some of what we're doing, we'll bring back to this consortia to say, hey, what do you think about this? Are we going in the right direction? So while there may not be anything outside of the consortium right now, just know that that's in the works and that we're all thinking about that as well.
Great, thank you. I was just thinking of the different healthcare, like every community college or every college has, healthcare programs. And I know this is my first time ever being here, and I don't know if Clackamas has ever come before, but I didn't know about it. So I'm super excited to be able to be here because we do a lot. And so it's interesting. And I know that PCC and Katie Ho was here earlier, but nobody from their healthcare training programs or education was here today. So I'm just kind of wondering like how the schools with their healthcare training get connected to the consortium. So I'm happy to be here.
Perfect. Okay, yes, thank you. I think I'm getting your question. No. Thank you for clarifying that. And I think I'm understanding the question even better right now. At the consortium level, we have representation all over the state, multiple folks for different variety of experiences, community colleges, universities, labor, representation, CBOs, state, et cetera. All of them bring back the information, well, or at least that's the goal, so that they would share. I'm glad that to know, well, not glad, I'm saddened to know that this is your first time, and I think you've heard from somebody else, right? But that's like the word of mouth right now in a way. But having that wide diversity of representation at the table, that's the goal, so that information is shared appropriately. All the folks across the state know what's happening, where they need to be, the opportunities that exist within the hack. And then at the consortium level, then we decide, okay, this needs to be advanced because this is what data shows X, Y, and Z, and then who is impacted and why. So
Yeah, it's amazing.
I'm
just gonna tell you.
Please continue to join. Yeah. Yes. Yeah.
Hey, Kathy Reynolds. I want to go back to the OHA comment because I want to actually underscore that. When we think of the different consortia, we're in a very unique place in that we have an entire part of the Oregon government focused on health. You know, if you think of the other consortia, they don't have that. And so I want to make sure that as we're moving forward, that we're really leveraging on a much more interactive basis what already exists, whether it's data, reporting, resources. I have the weird fortune of sitting on a whole lot of different state workforce committees and such. And the number of times I'm in one where I'm hearing something from OHA and then I'm in another one and I'm hearing people say, we don't know that. And I'm trying to connect people between meetings because I'm hearing it. And so I do think that there's something there about creating more connection between OHA and the consortium, you know, not just HEC, right? But this consortium, because we're in that unique space. And then to go back to the kind of college connection piece, I gave a shout out to Sabrina and this Columbia Willamette Workforce Collaborative earlier. So Sean was on the call from Southwest Washington. I forget who's in Clackamas now. They turned over. There we go. I meant to introduce myself earlier. And so that was where we brought the educators to the table at the local level. And so I was going to ask earlier, because I think a comment was made about how do the workforce boards communicate amongst each other? And do you have a forum to do that? And not just, you know, through the workforce development board or whatever. And so I'm very curious what we can do to help the workforce boards who are the local convening space for this work, how we can help them take what we're learning here and cascade that through into their regions. So what can we do to help that? And what can we do to enable the shared learnings? I love the idea of if we've got a RN to BSN online program, let's move that across the whole state. So it's just a great example of how one area can build something and it can be immediately implemented broader.
Thank you. And there is so much work actually happening for the sector partnership with the workforce boards, and they have a platform to share everything. And that's Jen. That's why I'm pointing to Jen. She's leading that right now all on her own, I think, right?
I would say that Oregon Workforce Partnership is their primary convener. And here,
no, okay. I see that you're transcribed. Thank you.
I am loud, but I'm not that loud. Oregon Workforce Partnership is their primary mode of collaborating with each other. And Oregon Workforce Partnership is a nonprofit created that has all of the executive directors of every local workforce board on it. So they all convene together. But in addition to that, they have business services folks like Esmeralda and like Sabrina that meet amongst each other through Oregon Workforce Partnership. I convene all of the business services folks as well, but primarily related to their industry engagement and their industry engagement grant that they receive from the HEC. So there is collaboration amongst all the boards, but I think it's a little bit interesting because it doesn't get to that granular level sometimes of like, you know, how many businesses did you talk to or how many trainings did you provide? But we're getting there. We're getting to the point where we're having some of these like deeper conversations, and it's really great to have. So sorry for the long-winded answer, but there are ways that they collaborate with each other.
Oh, no, yes, that's perfect because also recently, well, not recently, those recently because I've joined, but I know that Jen has been working really hard on producing those quarterly reports, getting them together from all of the workforce boards. And that what I'm doing, I'm taking those reports and I'm going through because she consolidates information really well in one with the specific things, what's happening, successes, outcomes, and also hopes and questions for us as a healthcare consortium and the healthcare sector specifically, for example. And then I started to reach out to individually to each, and then, oh, you don't know what that one is doing. Oh, can we connect? So this is where just recently started, but that's the goal again, to continue. I'm not stopping there. So, well, anything to add from the folks online? I want to make sure that everybody had a chance to participate, because if not, then we will move on and jump into the final presentation for today from our OHA partner. Yeah, I think that's it. I'm amazed we're almost on time. This is like we caught up. So how did we do it all? Okay, perfect.
Hi,
Well,
Shani. Oh, go ahead, Neil. Go ahead.
Yeah. I was just going to say thanks so much. I'm here with my colleague, Chris DeMars, who's online. I'll let Chris get us started.
Yeah, hi everyone. Chris DeMars. I'm the Director of Delivery System Innovation at OHA, and we are going to truncate this so we can get out on time. So next slide, please. And next slide. So overview of the report. House Bill. So I'm talking about a healthcare workforce needs assessment that OHA puts out every 2 years. So House Bill 3261, which passed in 2017, requires OHA to conduct an assessment on healthcare workforce required to meet patient and community needs every 2 years. It must consider, for example, workforce needed to address health disparities and medically underserved populations and the need for healthcare providers in rural communities. And it also informs our healthcare provider incentive programs that have been mentioned earlier during this meeting. And we are currently contracting with the University of Washington Center for Healthcare Workforce Studies and WWAMI, which is Washington, Wyoming, Alaska, Montana, and Idaho Rural Health Research Center, to develop this fifth biennial report. It's due to the legislature February 1, 2027. Next slide. So the goals of the report are to essentially describe factors impacting demand and supply. For this year's or this biennium's report is focusing on 3 workforce groups: primary care, behavioral health, and oral health, and then provide recommendations for addressing needs. And the approach is grounded in OHA's health equity definition, and we have a health equity committee's health equity framework, as well as other literature and data sources and reports. And in the chat, I'm going to paste our health equity definition that we use at OHA, and I'm going to pass it on to Neelam.
Yeah, thanks, Chris. If we could just go back to the first slide, if you could go back 2 slides. I just wanted to mention, because Chris had referenced that, the needs assessment informs proposals for OHA's healthcare provider incentive programs. And as Chris mentioned, you've heard about them today. We also do a companion report to this. I know it was mentioned, an evaluation of provider incentives. We do produce a biennial evaluation report. And this time we've contracted with our University of Washington research partners on these both reports. So we're really excited to contract with University of Washington. Part of the reason we contracted with the University of Washington is because there's a set of federally funded health workforce research centers, and University of Washington is one of those. So they bring a lot of strength and very broad, deep expertise in healthcare workforce. So yeah, then if you can then jump ahead 2 slides. So this slide provides some information on, who reviews the report and who contributes to the report. So this is a report that's ultimately reviewed and approved by OHA's policy making oversight board, the Oregon Health Policy Board. It's a 9-member board, meets monthly, and has a set of different committees that advise it, including a healthcare workforce committee, which is staffed out of our team. And so the committee will first review it, and then it will go to the Oregon Health Policy Board for the ultimate approval before it is submitted to the legislature by February 1st of 2027. We have a very broad range of different contributors. I mentioned the Healthcare Workforce Committee. We've also convened, we have an advisory committee of OHA workforce subject matter experts, a very, across the entire agency. They've been meeting regularly to provide input, and they'll be also reviewing the report and contributing content to it as well. And then, we also have been working with the HEC, particularly the University of Washington has been in touch with Amy Cox and her team to get a lot of the rich data that the HEC brings. We also regularly include the labor market information from the Oregon Employment Department. We also, are including information about the recent Oregon talent assessment that was released last month, as well as other education and workforce subject matter experts. I also want to mention for the HEC, we also did include some of the existing reports like the behavioral health talent assessment. We also have connected the University of Washington to the Talent Council as well, the Behavioral Health Talent Council. So this report really relies on a very broad range of different information. We also, we partner very closely with the Oregon Office of Rural Health. We contract with them for some of the healthcare provider incentive programs we offer, like loan repayment, loan forgiveness, are some examples. And we draw on their wonderful research, including that Areas of Unmet Healthcare Need report that comes out annually. And so that is all, going to be included as well. We also, engage with healthcare practices, healthcare professionals and students, and then other workforce subject matter experts. The needs assessment is not, does not include original research. It's more a compilation of existing data and resources. So next slide, please. So just to give you a sense of the report development timeline and how we're engaging with partners, we started this process a little earlier than what we've done for past needs assessments. We started with engagement with the Healthcare Workforce Committee back in September of 2025, trying to get feedback from them about what did they like about previous reports, what could be improved. And, they were the ones who identified they really wanted to see a contractor with very broad healthcare workforce expertise, which led us then to select the University of Washington. Once the University of Washington came on, then there was engagement done with the committee at a few meetings around developing a draft outline for the report. And so all that work happened in early 2026. And then at the May 13th Healthcare Workforce Committee, there was review and approval of that outline. That outline was included as an attachment. And in case you haven't seen it, it's fairly lengthy, has a lot of detail about the content that's going to be included in the report. And maybe after the meeting, Daria, we could email it around in case people haven't seen it. So that would be great. And then we're here today at the Healthcare Industry Consortium to provide, information to you all about our process and also to provide a high-level overview of the outline for you all. And then, in September and October is when we're really going to be moving into kind of a feedback phase on the draft report. Right now, our partners at the University of Washington are working on compiling all this information and data, and they're going to produce a draft report by early September. We have a Healthcare Workforce Committee meeting. I think it's on September 9th, if I'm remembering correctly. It's the second Wednesday of the month. And so that will be the first opportunity where the draft report will be reviewed. The committee will have an opportunity to provide feedback. We'll also do an educational webinar for the Oregon Health Policy Board so they can also see the initial report, provide some feedback. And then we're also planning to attend some partner meetings. We are planning to go, the Oregon Office of Rural Health has a Rural Health Coordinating Council that advises its work. And so we are fortunate to have an opportunity to go and present about the report and get some feedback from the Rural Health Coordinating Council at its September meeting. We also are very excited. We have an opportunity to go to the Rural Health Conference that the Oregon Office of Rural Health puts on annually. It happens in October in Bend, Oregon. It includes about 400 different partners throughout the state, covering a variety of different topics important to rural health folks. And so we have a panel presentation. So we're also going to be soliciting some feedback there. Our Healthcare Workforce Committee meetings are open. If any of you wanted to attend those meetings, those are public. You're more than welcome to come and attend and participate in that feedback process on that draft report. And then, we'll be moving into making those revisions, taking all that feedback, updating the report, and then at the December 9th Healthcare Workforce Committee meeting is when the report will be approved by the Healthcare Workforce Committee. And then that takes us into 2027. The Oregon Health Policy Board meets once a month, so we'll go to its January meeting. I believe it's January 5th for the approval of the report. And as I mentioned, it's due to the legislature by February 1st of 2027. So then after that, it'll be submitted to the legislature. So I'll stop there and see, does anyone have any questions? Okay, all right. So I'm just gonna wanna look at the time. I think I'm just gonna run through pretty quickly some of the outline slides because I recognize we've all been in this room for a very long time, getting a lot of really great information, and I don't wanna oversaturate you more than you probably already feel. So I'll just run through the outline very quickly. I would offer, if anyone would like to meet with Chris and me, we're more than happy to meet with you afterwards to answer any questions you might have. So next slide, please. So there is going to be a section of the report that covers factors impacting the healthcare workforce in Oregon. A section around what we term, I'm sure you're all familiar with the term social determinants of health. And so thinking about, how those impact work. What do students and healthcare professionals need to show up in the workplace and thrive? So, this is kind of a variety of, the issues that have already been discussed, housing, transportation, childcare, digital access, school quality. I'm sure you're all very familiar with these issues. Some of the changes happening at the federal level to insurance coverage, regulatory factors, availability of training and education programs, tech and AI, workforce, so a lot of these issues have already kind of been talked about and touched on earlier throughout the meeting. Next slide, please. For this needs assessment, we are going to be focusing, through that engagement process we did with the Healthcare Workforce Committee, they asked us to focus on occupations in 3 broad areas. The first is primary care. We've already heard how there is a crisis in primary care. The Oregon Health Policy Board has actually developed a committee to focus specifically on primary care, that the Primary Care Strategy Committee. And then, behavioral health, is obviously priority 2. And then our team also has some oral health workforce focus through our provider incentives, as well as we have a federal grant through HRSA to work on oral health workforce in certain priority areas of the state. So oral health is also, kind of an important focus area as well. Next slide, please. There's going to be, kind of a brief definition of each occupation included in the occupational group, education training required to attain a license or certification, and then scope of practice and prescriptive authority. We're going to be drawing on data from OHA's Healthcare Workforce Reporting Program, which collects data at the time of licensure, as well as data about other certified occupations where it's available. Next slide, please. And then these are some of the measures that are going to be used to describe the existing healthcare workforce: supply distribution, demand, demographics, practice characteristics, entry and education, and then turnover and retention. So I'm not going to read all these words on there too, but I think you all get the sense of this. And I'm, as folks who are involved in healthcare workforce, I'm sure you can appreciate a lot of these measures. Next slide, please. And then, this, again, this has kind of some of the data we're going to be using around licensed occupations, certified registered occupations, and then, for some occupations across all groups. So, again, we're going to be relying on the Healthcare Workforce Reporting Program, various state reports. We're going to be looking at the Mental Health Addiction and Certifying Board of Oregon, their MACBO data, census data, some of the data sources I already mentioned. Next slide, please. And then we're also, going to be drawing on areas of unmet healthcare need, various population measures as well. Next slide. And then we're going to, pose some recommendations based on the findings in the data and learn from the literature review. When we did the engagement with the Healthcare Workforce Committee, our previous needs assessment have had very lengthy lists of recommendations, and so we're going to be working with the Healthcare Workforce Committee to kind of develop fewer, more action-oriented, I've heard it a lot from this group too, what can we do? And with measurable goals. We're going to have a section in the report that also tracks, what has been accomplished over the time of the needs assessment. And we'll also, the workforce data is not perfect, so there are definite data gaps, so we'll also provide some information about that as well. And then I think that's it. We're welcome if anyone has any questions. And thank you so much to Daria for the opportunity to be here and share this with you. And I completely understand if you don't have questions right now, if you you can email us. You have my email as well, and Chris's. Feel free to reach out afterwards as well.
Yes, thank you both, Neelam and Chris. And Yeah, Chris and Neelam were till the very end, right up in the air. Are we presenting? Do we cut? Do we not? Thank you so much. No, I knew because we review. I saw this presentation. Like we need to somehow share this, and then yes, we can share that with the folks, like strategically or just overall with the whole consortium, and then you can share it with your partners. But what was interesting, I think you saw behavioral health, primary care, the work groups that are happening. I'm like, this is a perfect alignment and a segue into what we wanted to do, or maybe we'll just join strategically together with the folks in this consortium and then advance that work. Because so before I close today, I just want to make sure that that this discussion today also, probably you've noticed, was connected to the recently released workforce talent assessment, and many of the themes that we highlighted today are the ones that are surfaced there as well. So, for example, healthcare demand continues to grow. Workforce shortages remain significant across multiple occupations. We have competition for talent that continues to intensify. Rural communities obviously face a very unique recruitment challenge and retention challenges. There are a few more, but so I encourage, if you don't have yet time to read, it is pretty significant and interesting report. What is encouraging, though, that all of those themes, well, there's not the best themes, but they did align with the meeting today. They're like said reality in a way. But so what we were thinking, and between this quarter 1, 2, and now until today's meeting, I was thinking that we need to somehow connect the work that we do and connect all that feedback. And I know that we've been discussing since I've joined that we've had working groups. We were able to achieve things through all of that, and see what OHA partners are doing with their committees and work groups. Like more work can be done. And so I'm proposing to try something that we've been thinking behind the scenes with the team back in Hack. How can we strategically advance the work, and thinking that we can explore working groups where members of the working group could advance the work and then bring it back to the larger consortium so that everybody stays informed and really connected. And this is perfect because that's exactly what was the feedback from Q1 and Q2. What came out of Q1 and Q2, if you remember, and that's why I was so excited to see that slide here, primary care, any of the 4 pathways, and then behavioral health. So we will see the survey shortly, but for the next steps, let me just jump into the next step slide, and then we'll discuss quickly the survey and the working groups. So for the next steps, the next meeting is September 24th. Location right now is in the works. There are several things we're discussing. Then we will continue. We will have the working group assignments circling around. Then the strategic plan that was recently presented by one of the ELT members team at the WTDB meeting. And then we will continue to work. This is a dynamic plan, but your feedback is important, is implemented. It's narrowed down. It's very strategically aligned with only, like there are 4 strategies only right now. And then if we jump into the survey, so this is where there will be a survey. Please take a moment. It's only a minute to take that survey. And there you will be able to indicate your interest in which working group you would like to participate. But also, as you hear that, this is not a commitment. Oh my gosh, yet another group, yet another hour or hours of work. No, it is done strategically. I take into consideration your time, your busy schedules. Everything will be clearly aligned. You will know exactly what's happening, how long is the meeting, how often, who, how many participants, and one outcome, one specific outcome. We're not reaching for 5. It's going to be one outcome per working group. So, and then, yeah, that's it. So then indicate your interest, fill out the survey. Thank you for the folks online who bravely stayed, folks who are here as well. And we are actually adjourning. I can't believe it. With being 1 hour behind, we are adjourning sooner. Well, thank you, everybody. That's it.
So